honorable members, support staff, members of the media, everybody was on the platform. Today, we are meeting to consider the appropriation bill. We are visited by the Department of Health, who will be making a presentation to the committee as part of processing of the bill. Let me take this opportunity to welcome and greet the Minister of Health, Honorable Joe Pasha, Deputy Minister of Health, Honorable Lomo, Sibongiseni Lomo, the DG, Buthelezi. So there are two Buthelezis today on the meeting, the DG and myself. The DG and the whole management of the department, we are most welcome, and thank you very much for making time to appear before the Standing Committee on Appropriation. So before we proceed, let me check with you, Darren, do we have any apologies?
No apologies, Chair. Only Mr. Marais is in the meeting, but he indicated he needs to leave the meeting early because he will be on WOP's duty in the House. And that's it, Chairperson. Thank you.
Thank you very much. Let's note Honorable Marais' apology. What we'll do, Honorable Minister, we're going to give the meeting to you, and then you'll decide who speaks when. And once the department has finished, I'll be giving you an hour maximum to cover everything that you want to cover. And after an hour, the honorable members will then interact with the presentation, they'll make comments, they'll ask questions. And after that, the meeting will come back to you, where would request you to respond to the issues that would have been raised. That's how we're going to proceed with our meeting. Minister, thank you very much, and we do appreciate you are coming here all the time when we invite you to appear before us. That's very important. DM, we appreciate that because this is the only opportunity where, before we finalize on the appropriation bill, we can interact with you. Thank you very much. The time is 9:05, Honorable Minister, so I would expect the meeting latest to come back to me at 10:05. Thank you very much, Honorable Minister. You may proceed.
Thank you very much, Honorable Chairperson. Greetings to yourself, to all the I hope I'm audible. Can I just confirm?
Yes, you are audible, Minister.
Okay, thank you very much. As you have already acknowledged, I'm with my colleague here, the Deputy Minister, Dr. Lomo. We also have the DG Buthelezi. I'm trying to see I'm sure he's on the platform. We also, can I just confirm DG? Okay, there's DG and the CFO, Mr. Paswama Mohale. CFO, can you show your face? I know you'll come. Okay, those are the key people who will be conducting this briefing, but we also have a number of other senior officials from the department. They will come in from time to time. They may, based depending on what the DG has arranged. I'm not sure whether some of them may be asked to say something during the course of the presentation, or maybe at the time of taking questions. So that is the team We welcome this opportunity, Chairperson and the honorable members of this committee, because we do understand that the resources which are allocated to our department to provide services to our people, we have a responsibility to account, and amongst the various committees of Parliament, the Appropriations Standing Committee is very key, specifically in terms of accounting how we use these resources, and where we also fail to use the allocated funds for the purposes of the functions which are allocated to us. We have a responsibility to also account to this committee. So we take this task of accounting to yourselves on behalf of Parliament as very important. So, Honorable Chair, the CFO is the one who's going to take us through the presentation. You did send us a letter which guided in terms of the areas which we need to mainly focus on, and guided by that letter, the CFO, under the guidance of the DG and the rest of the senior management team, have prepared a presentation. I think we didn't anticipate the generosity of an hour, so we put pressure on the CFO not to take more than 40 minutes. So now that we have generosity of an hour, I'm sure he can just look at CFO just on a few issues which speak directly also to the matters which are in the letter of the chair inviting us to this meeting. You can elaborate a little bit on those issues, but please be conscious of the fact that you shouldn't go beyond. I know the chair said 10:05, but I would even say up to 10 o'clock. We should be able to cover the subject, and where DG wants to come in, I think you can be able to arrange. I mean, and here and there, Chair, we may, as a point of emphasis, as the CFO presents, between myself and the Deputy Minister and the DG, we may want to just emphasize certain points, but we'll stay within the hour, maximum 10:05. With your permission, Chair, can I then just check with let me just check with DG if that's the arrangement that we give over to the CFO, DG. Can I just confirm that?
Yes, no, thank you very much, Honorable Minister. Yes, the CFO will do the presentation. We will come in on matters of clarifications and answers later. Thank you very much, Mhlonish.
Thank you very much. With that, Honorable Chair, I see the CFO has already been allocated a co-host, which means you'll be able to share his presentation. Over to you, CFO. Thank you.
Honorable Minister, just before the CFO comes in, I've been alerted to the fact that the chairperson of the Portfolio Committee of Health, Honorable Jacobs, is on the platform, and Honorable Gela, again from the Portfolio Committee of Health, there is also on the platform. You are most welcome, honorable members, and thank you for being with us today. Thank you, CFO, you may proceed.
Well, let me also add to my appreciation of my boss's presence in this meeting. Over to you, CFO. Thank you.
Thanks, morning. Thanks, Honorable Minister. Greetings to the Honorable Chair and members, and Honorable Minister, Deputy Minister, DG, and colleagues. I will go through the presentation. On our table of contents, it's based on the invite letter from the committee. So those are the issues that we're going to cover within our presentation. As we start with the previous year's expenditure, looking on the performance of the department, there are detailed slides per program. but we'll also briefly just indicate in terms of the summary. When we look on the spending for 2022-2023 financial year, the department has underspent by 1.6 billion, but mainly will indicate the reasons. It's based on the earmarked funding and the indirect conditional grants. Under program 1, we have underspent by 106. There it was mainly because of the delays on the establishment of occupational health clinics, and also the payment on the rental payments for the Department of Public Works, and also some payments on our travel accounts and fleet services, and just the other procurement for tools of trade for the department. But also, Chair, what I can indicate on as we proceed on the slides, they are detailed in terms of each sub-program. So I will also continue in terms of each sub-program. Then in terms of the economic classification on the summary, we have also indicated the total, but I will just go in terms of each sub-program. As I was indicating in terms of sub-program 1, those will be the reason for the underspending that we have. So in terms of the public works, it's the 49 million, which we can see. And in terms of our economic classification, mainly those services are sitting within our goods and services. And those are the reasons which I was indicating, Chair. In terms of our program 2, the whole underspending, it was 212 million. You'll realize in terms of the sub-program is sitting under health financing and national health insurance with 203 million. So there was still a recruitment of NHI staffing and also the procurement of tools of trade for the staffing, including the furniture and computers and others. There is also the underspending under the GP contracting capitation, under the NHI, including our ideal clinic, quality improvement, and the patient information systems. So some, or mainly most of them, they're under our goods and services, which is 157 million. And under the equipment, it will be the 51 million that we have indicated under our capital. So those will be the reason that I've indicated within our program 3, which maybe I will indicate in details within this program, because there is 875 million underspending. If you look under the sub-program that says communicable disease, there is an underspending of 768 million. That is mainly, not mainly, all of it is the underspending on the vaccines. So there was earmarked funding for 2 million on the COVID-19 vaccines, which I will indicate as we also continue, because the same funding has been stopped. So that underspending, we did not continue to procure the vaccines as we do have enough vaccines within the country. And also under the economic classification, you'll realize that whole 838, it does include the 768 for the vaccines. And those will be the reasons which I've already indicated. Under our program 4, there is no issues. The performance, it has been satisfactory. It's sitting 199.95%. And then we have indicated in terms of economic classifications also. And in here, the only thing to indicate change that there has been the shifting of function in terms of port health services, which I will also indicate as we continue with the presentation. Within our program 5, there is an underspending on our health facility infrastructure management. That underspending, it was mainly due to Limpopo Central Hospital. So there were delays in terms of appointing the contractor from our implementing agent. However, we can indicate that the implementing agent, they have been able to finalize the processes. So the service provider has been appointed and they are busy with the site establishments in Limpopo. So there will be a spending and construction of the Limpopo Central Hospitals going forward. So you'll see that total of 400 is that one for the Limpopo Central Hospital. And in our program 6, there is underspending of 39 million. In here, there was a stoppage of HST services, which were discontinued. The tender for our DHIS was not yet finalized by the end of the financial year. So as a department, we're currently busy in the
CFO.
Thanks,
CFO. Please don't use acronyms. We may not be conversant with them ourselves, but also you are not just talking to us, we are talking to South Africans there. So if you are going to continue using it, please define exactly what are you referring to. Thank you.
Thanks, Chair. My apology. On the other one I was indicating is the district health information system. The one that was still under the procurement, which will finalize the procurement processes as the department. In our next slide, we're only indicating the
sorry, CFO, you didn't explain what is HST. I think that's also what the chair is referring to, Health Systems Trust. But if you could maybe just explain what the Health System Trust is and why we didn't spend. Maybe, I don't know whether the DG might help you there.
Yes, no, thank you very much. Health System Trust is one of the organizations that has been working with the department for a number of years. They used to do work for us, and they produce at least 2 most important reports. One is what we call the District Health Barometer, which is really an objective review on how we are performing in the system. And they would couple that report with the report that is called South African Health Review, where they'll pick up specific issues. For example, it will have different chapters looking at different programs on financial management. There will be a chapter on child health, there will be a chapter on communicable diseases, and then they pick up where we're doing well, what are the issues, and also on social determinants for health. So we started working with them a number of years ago, but now there were then a number of issues that we are trying to resolve that the AG picked up. Hence, we then stopped until those issues are resolved because their work really contributed for us to have someone really giving us an objective view on our performance. Thank you very much, Chair, and thanks, Minister.
Okay, thanks, DG and Minister, for the assistance. Then on the next slide, it's just a consolidation, but mainly the same reasons that I've indicated under the COVID-19 vaccination program. So we just indicate that underspending on the 2 billion that was allocated to the department, but I'll also indicate as we proceed on the reason for the decline in our budget. Under our conditional grants, the department has managed to spend 54.1 billion against the total adjusted budget of 57.7 billion. So in terms of percentages, we have spent 93.8%. So the major contributory grants for this underspending is our district health program grant, and also our health facility revitalization grant, sitting on 86%. And also our national health insurance, which is sitting on the 88.3%. So I'll also continue to indicate as we proceed on those grants. In terms of our NTSG and the statutory HR and training grant, the spending has been within the target norms. And currently the provinces are in the processes of requesting the rollovers. In terms of the grants, as I've indicated, Honorable Chair, so here we indicate in terms of our NTSG, how much we have spent, 96.1%, our district health program, which includes the HIV and AIDS, and the district health component. We have spent overall 93.4 on the HIV and AIDS, sitting on 92.1, and also on the district health component, sitting on 98.8. 99.8%. In our health facility revitalization grant, we're sitting on 87.2%, but we're going to indicate also in terms of the spending on the provinces. On the statutory HR resources, we have performed well, sitting on 99.3%, and also there are two components, which is the statutory HR on 100% and the training component on 88.6%. And lastly, our national health insurance grant sitting on 88.9%. So looking on the summary, just in terms of all the provinces spending on our conditional grants, currently the provinces are busy finalizing their records for the fourth quarter reports and also their AFS. So they are busy finalizing their accounting records. But in terms of the total the spending on the provinces, Eastern Cape it's performing at 99.5%, and Free State on 96.4%. The Gauteng, which is the lowest, on 87.9%, and KwaZulu-Natal on 92.4%. Limpopo and Mpumalanga sitting on 97.8% and 97.1% respectively. Northern Cape on 94.2% and Northwest on 91.5%, and lastly, Western Cape. And here you can see I've already indicated that the major underspending was in Gauteng in terms of our NTSG, the district health program, and also our revitalization grant, and we indicating the amounts. But if you also continue on the slides, we do indicate in terms of each conditional grant, how much it has been allocated within all the provinces, and what's the spending within all the provinces for each conditional grant. And we do indicate here that all provinces spend within the acceptable norm, except our Gauteng, which I've already indicated, which there was delays in delivery of medical equipment. On our district health program grant, it has two components, which is the HIV and AIDS and district health program. So the overall spending reflects a slight underspending on this program. Mainly it was the purchase of condoms, MMC, which is the medical circumcision, male medical circumcision, and some of the outstanding invoices on our NHMS. But in terms of how then the provinces they've spent, we have indicated on the next slide. In our health revitalization, which is the grant to improve our infrastructure, we also indicate the spending per each province, with the Gauteng sitting on 63.3%, as we indicate that the major underspending was recorded within Gauteng, and currently they are busy with the request for rollovers, and also Northwest sitting on 80.1% and Northern Cape on 81.5%. Then in terms of our statutory HR, which is for our employees and the training grant, the spending within this grant is acceptable across all the provinces, sitting on 99.3%, but we can note the spending in terms of each province. And here we have done the separation in terms of the statutory HR and also the training grant. In terms of our national health insurance grant, the expenditure is within acceptable norm, except Gauteng, Limpopo, Northern Cape, and Northwest, that they've underspent due to inability to attract specialists, because some of the provinces in the rural areas, they are unable to attract some of the specialists. But the provinces currently, they are busy with the application for rollovers through their provincial treasuries. Chair, when we go to the next bullet in terms of the request was to indicate the department's plans in terms of spending the allocated budget of 60.1 billion. So we firstly indicate the allocation in the department. We also indicated in terms of source of funding, how much have been allocated from the voted funds, which is 1.2 billion. In the earmark funding, 2.5 billion. Conditional grants, 54 billion. On the conditional grants, I would like to indicate that the 54 billion is the money that we allocate to the provinces in terms of our conditional grants. I will further indicate the allocation to the provinces. In terms of our indirect grant, which is mainly on our infrastructure sitting under hospital systems, we have 2 billion. Therefore, our total budget is a 60.1 billion. So the next slide, I'm just indicating in terms of economic classification, how the money it has been allocated to compensation of employees, goods and services, transfers, and capital. The reason for the decline in terms of the budget for the National Department of Health, we do have a decline within our compensation of employees. The decrease is mainly because of the transfer of function for the Port Health Services to the Board Management Authority as from the 1st of April 2023. We'll also indicate as it's part of the indication, I mean, the request to indicate the decrease in budget within our Port Health and Environmental Services. On our goods and services, there was a decrease of a 2 billion because there was a stoppage of COVID-19 vaccination earmarked funding. So the decrease of 52% from 64.6%, billion to our 60.1 billion is because of the reduction of that 2 billion within our goods and services, which was mainly meant to procure the vaccines, as I've already indicated. And then in terms of our transfers and subsidies, there was COVID-19 allocation that we were allocating to the provinces. So there was a decrease of 1.9 billion. So the decrease there is mainly because of the stoppage of that COVID-19 conditional grant to the provinces to the value of 1.9 billion. And also in the purchase of capital assets, there was a bit of a decrease in terms of the health facility revitalization indirect, which is sitting under the national department. But the one going to the provinces, there was no decrease because it's sitting within our conditional grants. We therefore indicate in terms of each program, in terms of program 1, that is the same allocation that I've indicated, only to highlight the allocation under the earmarked for medical legal committees, and also on the SACA program to support the provinces. And also on that whole funding is sitting under our goods and services. In terms of program 2, the indication that we want to highlight, Honorable Chair, is on our National Health Insurance Conditional Grant, the 694 million, which I will indicate the allocation to the provinces as I continue. And also under our National Health Insurance Indirect Grant, under our personal services, there is an allocation to our patient information system, to our medicine stock systems, to our CCMDT program, and also to our Ideal Clinic internship and community service program, and also indirect grant on our quality improvement. And then under the personal services component, we have the allocation also of 88.5 million. Also indicated the same allocation in terms of economic classification. When we go to program 3, that's where we also find in the HIV and AIDS. So we indicated the allocation of 23.9 billion, which goes to the provinces. We also do indicate the earmarked funding that we allocate to some of the NGOs, including the Lifeline, Love Life, Soul City, and also to procure condoms to SANEC, and also to other NGOs within the HIV and AIDS program. And we also have the earmarked funding for malaria elimination and also for our CCMDT. On the next slide, we were indicating the same in terms of our
maybe just
classification.
Again, CFO, when you say CCMDT, don't assume that everyone knows what the CCMDT. It's a very long acronym. I also sometimes fault in terms of the full name, although it's basically the distribution of chronic medicine to right up to at a community level where patients can pick up locally next to where they live. Chronic medicine dispensation, dispensing and distribution. Thank you very much. Just remember what the chair said, we mustn't assume all of us know the acronyms. Thank you.
Okay, thanks, Honorable Minister. And then within our program 4, the allocation to the provinces within our district health component, the 2.9, I will indicate the allocation to the provinces. Within program 5, that's where we also find in the revitalization in the provinces and also in the national department and also the National Tertiary Services Conditional Grant. So that's the grant where we finding our tertiary services, our specialized services within our central and tertiary hospitals across the country. The 1.3 billion, so that is the funds which are allocated on the national department, where the national department do the infrastructure implementation from the national, and that 7.1 billion is the one that's been allocated to the provinces. I will therefore indicate the allocation to each province. And then in terms of our program 6, the one to indicate here, Honorable Chair, is the money that we also allocated to the entities of the department, which includes the Office of Health Standard and Compliance, our National Health Laboratory Services, our Medical Research Council, our Health Product, the SAPRAM, and also our Traditional Health Practitioners Council. So we have also indicated all those allocations to each of those entities. We also finding the statutory HR and training grant, which goes to the provinces. We also indicated the allocation to the provinces in that regard. And then the next slide was just the allocation in terms of the economic classification. So the next slide, the Chair, I will quickly go through them. But as I was indicating during some of the slides where I was saying I'll indicate the allocation to the provinces. So the first one is with regards to National Tertiary Services Grant, which is the allocation for our central hospitals and tertiary hospitals. So those are the allocation to the provinces. I might not indicate by each province, but the total allocation is about 14 billion. In terms of our district health program grant, so this one, it has 2 components. I will go to the next slide where we indicated the allocation to HIV and AIDS component to the value of 23.9 billion, and also to our district health component where we have in 2.9 billion. So those are the allocation to each province, and the total value is 26.8 billion. In terms of our national health insurance grant, the 694 million. So those are the allocation to each of those provinces. Our revived, which is for our infrastructure money that we transfer to the provinces, as I was indicating, 7.1 billion. That is the allocation to all the provinces, Chair. And lastly is our HR and training grant, which we also indicated the allocation to all the provinces to the value of 5.4 billion. On other bullets, as per the request by the Honorable Chair on the invite, that the department must also indicate the possible service delivery implications that will have due to the budget declines. The first one was with regards to affordable medicine sub-program. When we also analyzed our budgets on our affordable medicine, there was an increase of 1.5 million, which was moving from 43.5 in 2020-2023 to 45 million in 2023-2024. However, we do indicate that there is a need for health equipment replacement within the department in the provinces. However, Chair, we also indicate, even though there is a little bit of an increase of 1.5 million, that's only sitting within the national department, but in the provinces, there will be a need to reinvent the pharmaceutical budget, because it's very important for the delivery of health services in the provinces. So therefore, we have encouraged all the provinces when we do our forecast budget on pharmaceuticals for 2023-2024 financial year per grouping. We do indicate based on those estimates, we estimate the ARVs, the budget, it should be 8.1 billion nationally. On the TB program, we should have 427 million, and vaccines 3 billion, and other medicines 7.3 billion. So that's the proposed pharmaceutical budget to ensure that nationally, even within the provinces, there is an adequate budget to ensure that the sector is able to procure medicine for the patients. With regards to our communicable disease sub-program, as I've indicated, there was a decline of 2 billion. That was the money which was allocated for the vaccines. So there is a stoppage of COVID-19 vaccines funding, and therefore the reason for the decrease is because of that stoppage of the conditional grant. In terms of our district health services sub-program, we also indicated the money that national was allocating to the provinces. There was a decline of 1.9 billion on the conditional grant that was allocated to the provinces, so that has been stopped. So the major challenges in the COVID-19 contracted employees, those were already integrated into the service delivery platform in the sector, and their contracts that expired by the end of March. So we have done the costing, so it came to 1.2 billion. We also did the costing because the sector, there is an inability to absorb some of our bursary community services in terms of our doctors and nurses. In terms of our doctors, calculations were coming to 942 million. And in terms of nurses, it was 168 million. We did have the discussions with National Treasury Chairperson in terms of indicating these budget pressures due to the stoppage of that COVID-19 in the provinces. And also we like to indicate that the COVID-19, it has created a backlogs in the elective and other surgeries across the country. So those will be some of the impact within that sub-program. And under the environmental and port health services sub-program, the decline is mainly, in summary, because there was the transfer of function in terms of port health services from the Department of Health to the Port Management Authority with the effect from the 1st of April 2023. But we would like to indicate that the same functions, they are still continuing. So all the budget that was allocated to compensation of employees, and also some of the equipments that we have, the assets we have to transfer to the Port Management Agency, and also the related funding for the port health services, it has been transferred to the Port Management Authority. So we also indicate that this is a continuation of functions as it was previously provided in the department as I've indicated. So the service remains intact, and the measures to mitigate against the spread of disease as a result of international travel, it does continue to be implemented. In terms of compensation of employees, what we're presenting here is with regard to the national department. We would like to indicate in terms of the number of posts that have been filled, and then we also indicate the vacancies, and also the pressure in terms of the proposed increase of 7.5%. So in terms of the sector, in terms of the calculations and discussions with the National Treasury for the sector, the pressure, it will be about 9 billion. And if the 9 billion is being funded, that it could equate to 18,000 posts within the provinces. So that will be an impact to the sector. Currently, with the discussions with Treasury, is that the funding, it has to be absorbed within the departments, but we still in discussions in terms of finalizing those. In terms of the next slide, we indicate those vacant posts in the number, which is 288, and the value in terms of costing to 207 million. and we indicate in terms of its sub-program. And then on the next slide, we also on the last bullet where we indicated the projected shortfall that is required to fill some of those vacant posts, because the funding that we have, it's not adequate to fill all the posts within the national department, but the pressure within the provinces, it will be higher than what we currently showing, Honorable Chair. And we also indicate the percentage of vacancy per salary levels from 1 to 8, 9 to 12. But on the next slide, I've already indicated that the budget is not adequate in terms of the first bullet, and also the increase in terms of the collar, the 7.5. And on the next slide, you indicate the stages of recruitment of the post within the department currently, which have indicated that they are vacant to the number of 288. So those are the numbers in terms of each program. On number 5, we're going to look on the contribution to South African Economic Reconstruction and Recovery Plan, BEE, and the procurement of the local items. So what we indicating on the first slide, Jim, is that about 49% of pharmaceuticals have been procured locally. So here, the reason why we indicate on the pharmaceuticals, because the national department is doing the procurement on behalf of all the provinces. So therefore, on all those contracts, about 49%, and also in terms of values, we have indicated in the next slide. So most of some of the medicines, we have to get them outside the country. But in terms of the other procurement, in terms of all other items, we do procure them within the country. And in terms of medical equipments, we did not indicate, it is still with the National Treasury, and some is done in the provinces. In terms of our policy here, we indicate that within our policy, we did include those ones where we indicate that we will support the BEE or the small businesses and the females and those who have disability. So that we have already done and included within our policy. And in terms of just indicating some of the statistics in terms of how then as a department we have performed in terms of supporting the small businesses and the previously disadvantaged. So here we indicate that the department supported level 1 service providers to 81%, and only those who are not contributing to the BEE, it was 11%, which is the total of 47 at the end of the table. Then you'll see in terms of level 5, 6, 7, 8, it's relatively 1 or 0 in terms of the service providers. And in terms of the contribution to the historically disadvantaged individuals, we indicated allocation of 68% and 31% to women and 1% to those who are disabled. And in terms of the legal impediments to the department achieving the economic transformation. So here, Chairperson, as we, Honorable Chairs, we were analyzing in terms of the health legislations, we do indicate that there were no known legal impediments in achieving the economic transformation. But just to highlight, Honorable Chair, and that was done only looking on the health specific legislations. But however, when we have to look on other legislations in terms of procurement and others, definitely that will be affecting the country as a whole, but not health as a sector. In terms of conclusion, that the committee knows the department's performance and the plans for the departments to deliver our healthcare services to the citizens. And I think I've tried to manage the timing as per the request of Honorable Minister. I will hand back. Thank you.
Thank you very much, CFO, for that. Just Chairperson, just on my side, as a form of just additional input. You did say in your letter also that we should reflect on what will be the challenges in terms of the allocated funds, considering amongst others that the previous allocation was 64.6 billion rand, and we're sitting at 60.1. I think the CFO has accounted for nominally to say just over 4 billion can be accounted for in the removal of the specific funds and grants which were allocated for COVID, starting with the procurement of vaccines, and then also the other support functions in terms of that, which the vaccine part we administered centrally, distributed to provinces, using also private sector in some instances. The balance, which was just a little under 2 billion again, is what we also distributed to provinces to support the mitigation against COVID, which now on this part, let me hasten to say, it also included not just goods and services, but which provinces procured to mitigate against COVID. That will be your PPEs and all other items, but also it helped provinces to contract additional staff to support the health system. Now, this is quite a sore point because in many cases, the staff which have been contracted included both the support services, but also professional staff, which included additional medical, including nursing staff. And it's been quite difficult for most of the provinces to now prioritize, find other funds within their equitable share to keep some of this essential stuff, because as you might be aware, I think Gauteng has possibly tried to manage, even though I know there was a lot of unhappiness, unlike the previous year where there was quite a big uprising, for instance, at Krisani Bara when they were terminating some of the staff, because what the frontline clinicians were saying was that many of the people who they brought in under the auspices of COVID were actually doing functions which had to be done even when there was no COVID. So terminating them was really putting them under a lot of pressure. So that's just one area which is immediately quite a source of pressure. But overall, when you look at it, the fact that there is not even an increase in terms of just catering for inflation, also even because what we are presenting here is the allocation for the national department, but as indicated, a big chunk, almost 89% of which we allocate to provinces. So when there is no growth, I'll just touch on a few items, maybe just starting with the head office itself. What it means, we've been under continuous pressure in terms of any ability to improve capacity at the head office, because the national department is not just a leader department for public health, but in terms of the law, we are responsible for health, entire health in the country, including regulation and supervision of the private sector providers. And that's why they are licensed and they function under a particular regulation. But as you might be aware, the health market inquiry, for instance, amongst others, were quite critical of the department in that we are not exercising that leadership and supervision and regulatory supervision over the public health. So and overall, for the national department to play a leadership role, you need the necessary capacity. But with the continuous pressure on reduction of cost of employment, it has made it very difficult, to sustain the posts at national and continuous pressure to reduce, but also uncompetitive. Where we are, we can't even compete with some of the teaching institutions in terms of the kind of salaries they are able to provide and attract very highly qualified people to, in those institutions. So as a national department, we are not very competitive in terms of providing that leadership. But again, coming back to the fact that 89, if not just around 90% of this budget also goes to provinces. So in the various areas, whether we're looking at the human resources training grants, the tertiary services grant, when there is no growth in those areas, what it means is that, for instance, on the human resources training, as indicated, we support especially your training institutions, your central hospitals, which are also training in terms of training posts. The specialist training, what is called the registrar's posts for the training of specialists. So if there is a stagnation in that area, the impact of that is that the training of specialists is reducing because you are not able to provide adequate support to the central hospitals to sustain. They're actually reducing the number of registrars, which are the specialists in training. The tertiary services themselves, where we need to support provinces in various ways, including services such as the fight against cancer, treatment of cancer, and other specialized services, were unable to respond to the explosion of non-communicable diseases such as cancer. On the HIV grant as well and TB, we're also unable we have not been able to grow that one. Now, this is quite a challenge because the total number of estimated population of HIV positive people in the country is estimated to be just over 7.5 million positive. In fact, when you go to our performance in the 1990, which is 90% of the population knowing their status, 90% on treatment, 90% of those on treatment having viral suppression. Well, because of the pandemic, we have not been able to reach our target for 2022. The next target in terms of the UN AIDS is 95. So from moving from 90%, the 2025 targets is actually 95%. Now, in our case, we're sitting at about 7.5 million people who are positive, and we're only treating 5.7 million. So we need to find another 2 million if we are to reach the 95% of treatment of those who are positive. Now, if we're going to increase to that, which is going to help us to also stop the spread, because when people are well on treatment and virally suppressed, they also don't transmit the HIV virus. Now, if we're going to do that, it means we're going to have to need more resources. But at the current moment, in terms of our allocation, even in the MTF, that's not looking very good. And what is more worrying, Chair, is that a balance of that, we also depend on donors, which is the two major donors, is the Global Fund, which is a multilateral fund where many countries contribute, including ourselves. And then we also have the PEPFAR, which is the President's Emergency Fund to fight against AIDS, which is an allocation from the American government. I don't need to say a lot about the risks of depending on an allocation from our friends in the US. Every time there is some differences on certain issues, they always raise the issue to say, you don't agree with us on this and that. It doesn't start now. It's been a threat even in the previous administration to say, if you don't agree on this and that, but we are giving you 500, I mean, currently is about $450 million a year, which helps, even though it doesn't come into our budget, but it helps with a number of activities in the fight against HIV, which we do appreciate a lot. But it is a risk because always there's a threat hanging to say we may take away this fund. So lastly, let me just touch on a point which the CFO said in terms of support of local business. We have been in the news some few weeks ago, and you do raise the question in your letter as to how are we doing in the support of local production. Now we've been in the news because one of the things which happened was that we procure medicines and vaccines, and in this particular case, there was a procurement of a children's vaccine, and for many years we had an agreement with a local manufacturer who is also partly owned by the state, called BioVac. Some years back, the state ownership fell under the Department of Health, but a number of years ago, I think around 2014, there was a wise decision to say it's not safe. I mean, it's not good that a health department which must procure from this company is the shareholder on behalf of government. So that shareholding was then moved to the Department of Science, Science and Innovation. So the state holds about 47% in BioVac, which produces vaccine. So for many years, BioVac had been the one providing us with the children's vaccines, and in this, and there was a particular contractual agreement which ended in 2020, and therefore this was now open for competition. And in this first time when it was in the previous round, the BioVac was the one providing those children's vaccines. But in this, so it's over 3 years. And when the 3 years, which is now expiring at the end of this year, there was a new procurement. And there was a competitor who had a price which was half of that of BioVac. And the procurement team, made the decision based on the kind of value for money and savings to purchase from the provider who was providing. That half was R1 billion less. So the other BioVac was at about 2 billion. The other provider was at R1 billion. So there was a difference of R1 billion between the two. So there was a lot of criticism because BioVac is a local company partly owned by the state. The other provider is a company which is operating in the country, but with the parent company in India. So essentially, in terms of the public domain, what was really punted as a contradiction, it was said that the Department of Health has given a contract to an Indian company, and mainly being because its parent holding companies in India, although it's got huge operations here. It's one of the companies which was also affected by the uprisings, the riots in Durban. Its plant was destroyed, but they've rebuilt it. So those are some of the contradictions that, and the same thing I can just mention, Chair, that one of the bigger consignment of purchase is also condoms. So we do come under a lot of criticism. It's condoms, it's vaccines now with the children's vaccines, or and what was punted in the media also was that like the local company has lost everything. But what we can assure the committee is that there are still other children's vaccines which we believe that the local company is quite strong and likely to retain its market share in that respect. It's also the antiretroviral treatment. As you can see, a big chunk of the 23 billion is also in terms of antiretroviral treatment. In that respect as well, there's always a pressure because, as I'm indicating, we are providing treatment for 5.7 million. We want to, in order to reach our 95% coverage, we need to go up to 7 million if we can find the people who are positive and put them on treatment. But to do that, you need more stock. And the pressure now is always also on that one, that there are local companies which do produce ARVs, But in terms of price, as you would expect, countries like India, China, where some of the other international companies produce, they produce at a lower cost. So it becomes very difficult for our local companies to compete. So those are the kind of pressures and contradictions sometimes which we find ourselves in. And I thought I should just add as I give back to you, Chairperson. Thank you very much. Sorry for taking a bit of time, Honorable Chair. Thank you.
No. Thank you very much, Honorable Minister and the team. I think it's time well spent. Honorable members, you know how we do it. So what's going to happen now? I'll be taking the names of the honorable members who would like to interact with the presentation. Okay, just as okay, honorable member, Honorable Tobias
Matafa.
Mlenzana.
Sheikh Imam.
Honorable Sheikh Imam.
Kaiso.
Honorable Kaiso. Is it all honorable members? Okay. Before I allow honorable members to come in, let me also recognize Honorable Dr. Northnachel and Dr. Harvard from the Portfolio Committee on Health. They have also joined the meeting. Good morning, honorable members. Let's start. Honorable members, you know, I'm very liberal these days. I'm not giving you time, but just be aware that straight to the point and allow other members to also interact with the presentation. So I'll start with you, honorable members.
Thank you very much, Chairperson. Thank you very much to Honorable Minister, Honorable Patla, and the team. The presentation indeed is very enlightening. Happy to be briefed to this extent. The areas that one would want to ask questions and also call on the department and the minister to ensure indeed we don't lose the ball is on the side of under spending. From where I sit, it is a crime looking at the depressing situation in poor communities of our country. You know, any story about justifying a lack of spending when you finally have budget. So I would then want a commitment and clear plans to avoid under spending, because it's something that we should not be talking about, should be avoided, looking at the needs of our people on the ground. That's one point where I would want clear commitment and clear plans to avoid it. No justification of it. We must avoid it. The second area that I want to put emphasis is on vacancies. You know, this thing of having vacancies, huge vacancies. When you look into the level of unemployment, the poverty situation in our communities, indeed you can see that this is a crime too. So we should avoid justifying it whatever way. So it should be avoided. We should to do our best to move on those. So we want clear commitment, clear plans on steps that should be taken to ensure that we do away with vacancies we employ when we have budget to do so. I would want clear plans there. Maybe 3 questions would be on the national health insurance that we're talking about. It has been with us now for some times. we now need to check the readiness of the department to roll it out. In particular as a priority. So the question then would be, what are the key hindrances to the finalization of the NHI bill, and what measures are being employed to overcome them? The second question is still related to it. Has the department done a study or assessment of the infrastructure needed to roll out the NHI? The last question on the same issue, what is the human resource capacity that the department will require to implement NHI? I think I'll stop there, Chairperson, before the other members' opportunity. Thank you very much. We appreciate the presentation. It is enlightening. We are more clear now, in particular for the rural provinces. Thank you very much, Chair. Thank you, Chairperson.
Thank you, Honorable Mezi. Honorable Tobias, please come in.
Good morning, Chair, and good morning, colleagues and our guests. Thank you very much for the presentation, Minister. Chair, can I first start with making comments? The first comment is that when we're having meetings, at some point to invite the National Treasury to explain that where there are shortfalls in budget allocations, especially for departments like this one that deals with essential services. And I'm saying this because I realize that the frontline public servants like your doctors and nurses are needed, and there's no strategic budget allocations. And perhaps we might want to hear ourselves, the National Treasury accounting to why they didn't necessarily prioritize that. The second one, it's on the cost of living adjustments. If any department that will be compromised is this one, the police department, because they provide very important services. Therefore, at times we need to ensure that COLA just on the basis of the inflation at every fiscal year to make sure that we don't frontline services because we really not want to have such type of people being able to be productive. The next question, I will want to understand from the minister, how have you so far engaged the National Treasury to understand the importance of NHI? And it's a policy imperative that the governing party has taken. It's not for National Treasury to decide for your good selves at what point they're going to implement the NHI. I want to know whether, have you pursued from other levels, including ministers responsible for the fiscals, to understand the importance of National Treasury officials to implement and not take a view on NHI? Chair, if you allow me, I'll come back later on other matters, as I want for now to address policy imperatives. Thank you very much.
Honorable Tobias, you are muted. Please come back. Yeah.
Did you copy me in all what I said?
No. The last part we lost you. Please, if you can just come in.
I just said now. Let me throw those policy and use that. I'll come back for specific questions later, if allowed, if there's a space for that.
Okay. Thank you, Honorable Tobias. Honorable Matafa.
Thank you very much, Chair. Good morning to your good self, Chairperson, Honorable Minister Patla and Deputy Minister Domo, DG and the department team, as well as members on the platform, guests, good morning. Chair, let me start first with the closing remarks from the Minister, which are highly appreciated, the same as we appreciate the presentation that is made. It is a very comprehensive presentation, and also how it was narrated is very assisting to the work of the committee. And from where I'm sitting, Chairperson, I think it succinctly responds to the questions that we have posed to the department. The closing remarks in question, Chair, the Minister made is in relation to local procurement. And then he raises a very valid determinant of who is awarded what, which is the price. And obviously, depending on where you are located in the world, the price will be a disadvantage to you. And that is why some countries are called developed economies, others are called underdeveloped economies. So when you are an underdeveloped economy, according to me, Chair, your running cost and manufacturing cost will be too high, and you will want to make up for the input costs in your price. Now, I think, Chairperson, we cannot let the situation be as it is and remain as it is, where our local manufacturers and suppliers are disadvantaged because of price. This committee, Chair, took a study tour to South Korea in December, and we all know what the parliament there indicated in terms of how they supported their local companies, your Samsung, your Kia, Hyundai. Of late, Chair, the biggest challenge that the world is facing is on semiconductors. Again, the government came out guns blazing that Samsung will get an all-out support. That's what they call it. All-out support to ensure that their competitiveness and profits are protected. And they will make sure that they will advance all incentives, tax benefits available to ensure that that happens. Chair, you can name other interventions by other countries in terms of how they supported their localization. I want to put it to this committee that I think it is time, Chair, that we have a conversation with the National Treasury or the Department of Trade and Industry to find out exactly on the pillar of the ERRP, how do we support the localization aspect? Because it is one of the critical pillars that the president has put in place to say localization must be supported to ensure that there's competitiveness and the economy is also stimulated from bottom up. I wanted to make those remarks, Chair, and a plea that maybe that conversation, it's time that it happens, so that next time we're able to say, based on this pillar of local economic development, in the manufacturing of pharmaceuticals and medical equipment, these are the incentives that government is putting in place to ensure that this particular issue of price being a disadvantage for local suppliers is eradicated or is minimized. Chair, maybe let me move to the area of questions that I have. And the first one is on the issue of NHI. Honorable Memezi has touched a little bit on the issue. Maybe my question is if whether the department believes that the funding as far as NHI is concerned is sufficient. And secondly, in terms of the progress that is made thus far, is the department happy? And maybe if they can, just share with the committee what is the likely full implementation timeframe, where we'll be saying we are now moving on to the last phase of the implementation of the NHI. I'll really appreciate it if we can get that particular feedback. Chair, the second question that I have is on the issue of vacancies. Noting that due to the budget cuts, there are certain bursary schemes that had been abandoned and justifiably so. My interest will just to find out, Chair, the pressures that are created by these vacancies in which provinces do they obtain, and how do we mitigate the negative service delivery impact as far as these particular vacancies are concerned? Chair, the third question, I think it was slide 29 and 30, which deals with the area of underspending. And the province concerned was the Gauteng province. And the reason that is given is that the underspending was caused due to delays in delivery of medical equipment. My question, Chairperson, is just to find out if the delays have been identified as to what is the reason that led to those particular delays. I note that there is a request for rollover of the funds that were underspent from the department. But for me, Chair, it will not help to roll over funds when those bottlenecks that led to the delay of supply of this equipment remain unresolved. So I just want to find out if whether have they been identified, have they been resolved, and will a recurrence of such be prevented? And Chair, maybe on that one, in terms of Gauteng, can we be briefed in terms of the area of the facilities in Gauteng that were affected or impacted by this particular underspending as a result of delivery of the said medical equipment? The minister was very clear that there were uprisings in Gauteng due to other concerns of service delivery. So maybe it's for us worth a while to know which areas have been impacted, and maybe just to see if whether did they have any role that they played there. Chair, my last two very pointed. What is the status of the creditors book in terms of how many, or what is our performance in terms of payment of service providers within 30 days of invoice? The last one is on the youth allocation in the BEE space. We welcome the report that was identified, and it's a very beautiful looking report that even people with disabilities are covered in terms of the economic participation in the department. The one element that we miss is the category of people below 35 years. I would really love to have that information, Chair, for the benefit of the committee, even if it's not today, but it can come later as we normally do, receive follow-up questions, responses to follow-up questions after the fact. Chairperson, that is my input for now. I appreciate the opportunity to participate. Once again, thank you to the Minister and the DM and the entire team. Thank you, Chair.
Honorable Matafa, thank you. Honorable Mlenzana, please come in. Honorable Mlenzana, are you not muted? Darren, do you still have Honorable Mlenzana on the platform?
He has been kicked out, Chair.
Okay.
Chair,
okay.
Mr. Mlenzana called me, said that he's struggling with network. He's going to send the questions to me, and then I'll either I'll read them out or I'll send them to the committee.
You'll read them out for the benefit of the public, right? Honorable Sheikh Imam, please come in.
Thank you very much, Chairperson. I can inform you this morning that I'm not moonlighting, so you got my full attention.
Yes, thank you.
Let me welcome.
We missed you, Honorable Sheikh Imam.
Are we allowed to moonlight? Can I moonlight?
Yeah, we moonlighting with no additional pay. You know, at least when you're in the health sector, you can moonlight from private to public, and you're getting 2 salaries. So our fiscal condition doesn't allow us to get a double pay. But be that as it may, allow me to thank the department and all the relevant authorities and structures for their presentation in this morning. Right, let me start off. My first question is to the department. Can you tell us what facilities have you got for healthcare workers, wellness programs and things, given the fact that particularly during COVID, and remember the kind of work that healthcare workers do, particularly in hospitals and things, always seeing people die, people suffer before they die, a whole I think it's a very traumatic experience to some extent. I know some tell me that they become immune to it because they see so many, but I don't think. I think there's a human side to all of us. And so I'd like to know what measures are you putting in place to look consistently at the welfare of your healthcare workers. The second issue is on training colleges. Are you planning to build more training colleges for nursing staff and things, given the fact that, you know, the private sector particularly and international companies and institutions are taking away a lot of our healthcare workers and skills from the country? So that's the second one. Now, a very important thing which I addressed the other day, Chairperson. We can't continue the way. We can't be having people dying at such communicable diseases is on the rise in South Africa. And a lot it has to do with what we eat, what we drink, and our lifestyle. I would love to know from the department today, because I don't see any provision for it. Are you planning in the future to ensure that there's budget allocation to move away from a curative but to a preventative healthcare system? I think you need a dedicated budget, a dedicated team to be able to deal with this. And I'm going to give you some good examples. Look at a can of cool drink of Coca-Cola, 9 teaspoons of sugar, Chairperson, and look at the rise in diabetes in the country. Look at the rise in cancer in the country. I have been advised by some that are doing research, even this dishwashing liquid is one of the root causes, and there's evidence to that effect. Now, I'm not going to go into the merits. I'm not an expert. However, what I find is, Chairperson, not enough is being done. Anybody and everybody opens up any kind of business, particularly in the food sector. There's no oversight. Nobody checks with it. I know there's a problem because national health and city health is two different things. City health, in my understanding, don't report to national health. I remember at some stage we were talking about incorporating them all and falling under the national health. There's very little that is happening on the ground. And I think the time has come for us to dedicate a budget. Enough advertising must do. There must be oversight into all these products. I think we are just flooded with products, and there's no mechanism to see exactly what is going on, what is in these food products that we are eating, that people are getting sick at such an early stage. And look at the impact it's having on the healthcare system in the country. Now, a very important question I want to ask is, oh, by the way, Chairperson, there is this Johnson & Johnson product, the powder, which is banned internationally. But I see it being advertised on special in every other supermarket chain in South Africa. And I don't see anything happening about it, really nothing. Now, I know some of these things fall under trade and industry, but together with health, but I think we need to come together on that. On the issue of NHI, I want you to take us into your confidence and tell us, do you believe with what you have currently in terms of your infrastructure, your human resource and things, your primary healthcare services that you provide at the moment, that you're going to be successfully able to implement NHI? Most people in the country are not convinced, even though they want NHI to be introduced. Now, you need to tell us exactly what you need as a department for you to make a great success out of the NHI. And I don't really see much in your budget proposals to be able to deal with it. And so I'd like you to take us into your confidence as far as that is concerned. Now, the other issue is, and I think, Minister, we discussed this, I raised this matter before, we, government, funds a lot of the students in medicine. Many of them qualify. There's about 1,200, I'm told, at the moment as I speak to you, who have completed their community service. And because of budgetary constraints, they are not able to be absorbed. Every one of them. And I know you said you were going to. You there, sir?
Honorable Sheikh, we lost
you. Yes, I'm with you, Chair.
We lost you for a second or
Oh,
two.
okay.
Please just stop your video. Then I think we're going to want to.
Can I put the video on?
Yes, you can. Thank
Yeah.
you.
Thank you very much. I've noticed that all the members, when they were speaking, were being interrupted through, I think it's the network chairperson. So, yeah. But be there, yes, I was talking particularly about the over 1,200 graduates that have completed the community service, which I have spoken to you, Minister, and I know you indicated you were going to speak to the Minister of Finance to find resources to be able to accommodate them. Now, remember, we spent money in training these people, and we don't want to lose them. Can you imagine if all our graduates, or a large percentage, that taxpayers' money is paid on for their study purposes, and then you lose them to the international community, or you lose them to the private sector? That's not acceptable. Now, I'd like you to tell us, what are you doing about absorbing them and in the future, because I don't see much provision for that. While you talk about vacancies, I see that we're not talking about we're not taking into consideration that we have a need for these particular graduates, and we do not have the, because it's a provincial mandate, they've got to employ them. They don't have the resources. We are ending up with a serious problem as far as that. So you need to tell us what you're going to do about them. Then my other issue is the board exams that are written. There is a repeated concerns being raised, Chairperson, and through you, Minister, which I raised as well, that there appears to be a lot of corruption as far as those that have studied abroad, writing board exams in South Africa. I'd like you to look into that and tell us. Now, I want to talk about vaccines, Chairperson. It was a huge hue and cry when there were people opposing vaccines, but there's repeated report by experts. There is now matters before the courts in different parts of the world raising concerns where it has now been established to the number of side effects of vaccines. Now, what is the perspective of the South Africa, the Department of Health and South African government on this, given the fact that there's evidence to show there are numerous side effects to these vaccines? And what is your view on the fact that normally vaccines take about, 5 years, 10 years for trial? This was done in a couple of months, and the impact it's now having on the healthcare in South Africa particularly. And if you find more and more people are dying at a very young age with strokes and cardiac arrest and things like that, I hope in the future there'll be a new World Health Organization to counter this one, so there's no manipulation be that aspect. You say you have a lot of vaccines in stock. I've seen a report recently as well. So what is going to happen? Are they going to, when they expire, are you going to dump them? How much are we going to be losing? I see that it's very unfortunate that the man that saved so many lives in South Africa, you now appear to be wanting to attack this man, and you've charged him, Dr. Shankara Chetty. It's very, very unfortunate that we are manipulated in this country from a health perspective. Now, condoms, I repeatedly see a problem as far as condoms, and yet we have such a high unemployment rate in this country. Why are we not manufacturing our own condoms? And when I talk about that, I think my colleague initially spoke about manufacturing, producing medicines and things, local production and things. The number of products, particularly plants, that are being used internationally for medicine from South Africa, indigenous plants, is shocking, and we're not taking advantage. There's a big demand for it. So I think that not only in South Africa, the entire SADC region, I remember we passed the motion in the SADC parliament, but very little or nothing has been done as far as that is concerned. I'm not going to complain too much about your underspending, even though I believe it's not acceptable. I'd rather you underspend than fiscal dumping in the last quarter, which for me is a serious challenge. So, Chairperson, I will stop there for now. And if perhaps we have some time, then we can come back with some follow-up questions. I appreciate it. Thank you very much.
Thank you, Honorable Sheikh Imam. Honorable Kaiso, please come in.
Thank you very much, Honorable Chairperson, and let me greet the Minister and together with his team. And thanks for the presentation that has been made before this committee. Honorable Chair, I have a number of issues to raise and question to raise and perhaps suggestions. Honorable Sheikh raised something important around condoms, but I'm not going to talk about condoms, Honorable Sheikh.
Chair, why are the male MPs talking about condoms, Chair? All the three have spoken about condoms, Chair.
Continue, Honorable Kaiso.
I'm sure I'm protected from that intimidation, Honorable Chair.
Please continue.
No, I'm saying contrary to raising issue about condoms, I want to raise an issue around the state-owned pharmaceutical company. I think it's a very old resolution that we have in that we need to implement that. But it does seem to be one of the things which it has some resistance from somewhere, I'm not sure. But given the fact that there is a high price of medication and the import of medication in the country, it does tell us something that we definitely have to know or get an update as to what is the problem around the issue of ensuring that there is a state-owned pharmaceutical company. Because I think it has a huge budget, but it doesn't seem to be really taken so serious. But in my own analysis, given the fact that the price of medication, which is important, and I think a lot of medication or some a reasonable proportion of medication is imported from USA. And you'd remember that the interest in that country has doubled, if not tripled recently. So now you add our own inflation in the country. So obviously we're paying high price of medication, Honorable Chair. If you can allow me to switch off my camera to allow maximum internet. So we're paying a lot of prices for medication, imported medication in the country. And yet, and that it's not its cost to service delivery is not adjusted to CPI. So which is adding the burden to the department and department budget. So now it does tell us that now a lot of budget intervention it is needed, and some of these things you cannot avoid them. If, for instance, we find a situation where US interest rates have tripled, and yet we're supposed to get imported medication, we even add the cost of importing medication. At the same time, we are unable to implement a resolution which says, let the state create its own pharmaceutical company so that it can be able to carry on this cost on its own at a very reasonable price level. So we are unable to do it. So I just want to get an understanding from the ministry as to what are the hindrances towards this achieving this golden rule. I'm also coming back to issue of on security of personnel. The frontline health professional or workers are playing a leading role in as far as ensuring that they are, they sacrifice whatever means that they have to ensure that the services, given to our people. And some are killed on duty, You had a number of cases in the country where health workers would be killed. Recently, there was a doctor killed. I'm not sure which province was it, in Mpumalanga or somewhere, and other health workers in other provinces got same incidents. Now you also have incidents such as no closure of community health centers because of security of health workers themselves. I'm not sure to what an extent has the security of this institution has now been secured in such a way that it should not hinder services to our people, because if then community are forced to say, we rather close this facility because of the security. And you would remember there in Mangaung, just a CHC next to the police station, health workers had to be under siege during the night, and a decision arrived at to say, let this facility close for now because of insecurity. Why doesn't the department think abroad around the issue of provision of security in our health institutions, such as that there is no need to shut down or to close a health facility because of security? Instead, there should be strengthening of security, systems in the institutions, because our resolution says we must put in place strategies to ensure access to healthcare on 24-hour basis. So if we can start to reverse that, we will definitely be working against our own resolution. So my question is, are there difficulties that the department should at least ensure that there's a security, a proper security structures, infrastructure put up in all the CHC and all other health institutions where security is a problem, can be secured? Now, the issue of NHI, I agree with my colleagues there, is a similar problem as, I want to interpret as similar as the problem of implementing a state-owned pharmaceutical company. When we look at the when I look at the NHI and the state-owned pharmaceutical companies, I often think, Honorable Chair, that instead of seeking a solution as to how to implement this tool, it's like there is a small corner which says, let us look for reasons as to why we should not implement this. You see, there is that contradiction which comes up into my mind every time when I look at these two reasons, which are very key in terms of service delivery. And this is really, they should be low-hanging fruit for service delivery for our people to see basically that, yeah, there is a service delivery now, because we are able to do things at a very reasonable price level. Accessibility is very high now. We no longer complain about imported medication, expensive, etc. We have our state-owned pharmaceutical company. We can produce our own condoms and provide our communities, our people become safe. The other questions, Honorable Chair, that I want to raise is the issue of accruals. I just want to know from the department, from the minister, what is the total amount of accruals of the department? If we can, this committee can be provided with that information. And linked to this issue of accruals, I want to check. Yes, in the presentation, one has seen a breakdown in terms of underspending there and there and there and there. But I also want to propose to also suggest that we should rather have information breakdown to this committee received in as far as underspending on budget vote over a period of 5 years, and underspending by the department in as far as indirect grant and direct grant over a period of 5 years. so that in future we take cognizance of this development when we're dealing with the department moving forward. I also want to check, because there has been a number of incidents in the country where it does seem that the issue of migration has caused a burden to the department, and to such an extent that we, it is being interpreted, in a different way, and it can to lead to some extent what we can call xenophobia or phobia of some sort, because now there's influx of which is being caused by issue of migration in our health institution. It can be interpreted otherwise, but I just want to check whether has the department taken into consideration the issue of the impact of migration to health institution, in what way? Yes. Now, yes, of course, like I've said, Honorable Chair, the issue of because the department has raised issue of reduced budget, but one would encourage that definitely Treasury has to come in there, because of a lot of pressure that is going to emanate from what is being discussed at another platform with regard to salaries, etc. So obviously this is going to bring a lot of burden to the department, and the department definitely has to be assisted to come out from that overburdened situation, because definitely it does tell us that not enough budget has come out automatically to cater that specific area, which has to do with the compensation of employees. And I also want to know, what is the cause of the slow kick of some project in the department? The rollout of infrastructure. There is a slow kick off in some project. So what could be the reason thereof? And lastly, Chair, just two last one is the issue of training colleges. I know of existence of training colleges, but I'm not sure.
Mr. Zondi,
I'm not
please,
sure.
Mr. Zondi, please mute.
I'm not sure, Honorable Chair, that what has happened to training college, but in as far as one still remembers, there are nursing training colleges. The last time was that they're supposed to reopen. I just want to know to what an extent has this been taken care of? Yes, I just wanted to get a clarity from the department as far as that is concerned. Now, lastly is what measures is the department trying to assist the province in as far as their understanding? Thank you very much, Chair. Let me pause at this stage.
Thank you, Honorable Kaiso. Honorable Ntlangwini was on the platform, but she had to leave because she is having another responsibility, that debates taking place today. But the questions that she had just sent to me, and she asked me to ask them, yeah, on her behalf. Minister, the question of malaria, of malaria, what's happening around that? Are we doing anything? Is there an upsurge of malaria anywhere? And what are we doing? And also comment about the budget that is there put aside for malaria. She's also raising a question of what are the initiatives from our side to deal with the question of health, of mental health, especially amongst the poorest and the rural communities. the question of treatment of health. This looks like to be a privilege of those who are in urban areas. What do you think? Would you say that the rural communities are being taken care of this? The health facilities which are able to provide cancer treatment. Again, please share with us. Those will be the questions which came from Honorable Ntlangwini. But before I come to my questions, let me just take the last round from the oral members. Oral members, anything from your side? Oral Memezi?
Chairperson, thank you very much. I think the one question I think I'm not sure if any member would have thought of looking at the expanding health facilities and accessibility to healthcare in rural and underdeveloped provinces. According to me, indeed, is something that even our organization as ANC has resolved on. Now, the question would be, to what extent is the department working with the Department of Higher Education to expand health facilities in universities and nursing colleges as a strategy to increase the number of health human resources to reduce the skills shortage gap in the country's health system? I think indeed that is a question I'd want to pose, Chairperson. Thank you very much to the Minister and the Deputy Minister. Thank you.
Thank you, Honorable MMS. Honorable Tobias, anything from your side?
Chair, only one question. I would like to know how much money has been set aside for research and development on vaccines. That's the only question for now. Thank you.
Repeat the question.
I want to know how much is allocated to development of vaccines.
I'm sure you got that, how much has been allocated for development of vaccines, right? Thank you. Matafa, anything from you? And all members, can all of us mute so that we can allow the speakers to come in uninterrupted? Members, please check your gadgets. Check your gadgets. Thank you. Check your gadgets. Please come in, Oral Matafa, if you've got something. Oral Matafa, you may be muted. I don't hear you. Darren, you said Honorable Nzana was going to send you questions. Are you having those questions now on his behalf?
Chairperson, no, I haven't received anything from Mr. Nzana.
Perfect. Honorable Sheikh Imam, please come in.
Yes, thank you very much, Chairperson. Yeah, I'd like to know from the department, medical legal claims. It seems to be on the rise, and how are they dealing with that problem? And are they budgeting separately for it, or where is it coming from, you know? And how are they going to try and prevent that? And more importantly, from the many medical practitioners in the health, both in private and public, particularly gynecologists and things, are leaving the profession or leaving the country rather, Chairperson, and I'm worried about that. Could the department tell us what are we doing that? And that
we lost you, Honorable Sheikh. We lost you.
is as a result of the large medicine. I think if you can just tell us on that. Yes, it's on the medical legal claims, which is on the rise, and how is the department trying to prevent that? And very importantly, also lose the skills like gynecologists and others that are leaving, even leaving the country because of medical legal claims, where everybody wants to just sue them and things like that. So it's becoming a
Okay, we got the gist of your question, Honorable.
problem. And are we not going to have a problem? Limited skills. Can you hear me, Chairperson?
Yes, we heard you. We heard you, Honorable Sheikh.
Okay. Thank you.
Thank you. Honorable Matafa, do you want to come in? Okay. Honorable Kaiso.
Chair, just one. on issue of ambulance or emergency service. I just want to get the clarity from the department. Why is it difficult for the department to? Honorable Chair?
It's definitely not me, Chair. It's not me.
Yeah,
Honorable Chair?
No. Bengithi bankhona te shaya ikhwela, so but continue, Honorable Tyson.
Okay. I just want to know from the department, why is it difficult to ring fence budget for emergency services? I can remember, if I'm not mistaken, currently one ambulance serves for a population of 10,000. But currently, if you look at a situation, you find a situation where you think it's probably up to 20,000 per ambulance. So why the department doesn't ring fence, for instance, the budget for emergency service? Thank you very much.
Thank you, honorable members, for the questions and the comments. Let me come in. The question of procurement, it's a big deal. I'll tell you why. You see, we are dealing with the question of the budget, which is not increasing, of health. But that's what you get from many departments, and that's mainly due to the question of the GDP, which has been very sluggish for many years. So then we rightly so, the president presented the economic reconstruction recovery plan to say, let's grow our economy, because it's only then that we are going to be able to get more revenue for SARS, so that SARS can bring that money back to us, and then we are able to deal with all these challenges. So as we do that, all of us have got a role to play. That's why the oral members are busy on this thing of it's so critical that we procure as much as we possibly can and create the conditions that we procure things, goods and services, mainly goods, that we say goods here, which are being manufactured and produced locally. Why is that? Because oral members, Minister, Deputy Minister, DG, and the team, we must always have this at the back of our minds. Whenever we pay money and we import something, we must know that the contribution to the GDP is negative. The GDP equation, anything we import, it's a negative. So just by doing that, we are contributing to the economy not growing. And I understand the situation of the price, because it's the law that is there that we are dealing with. Yeah? But when you look at this thing, you say there's a bigger price than the price that is being considered, what you call a social price. How would you look at the social price here? Is the total impact, the price that we are paying to the economy, or the opportunity cost. For instance, whenever we do that, we contribute to unemployment. Whenever we import, we contribute negative to the GDP. When we do that, we are saying, yes, we are going to collect less taxes. So the panacea of our problems, and us as a department getting more resources, is a question of making sure that the economy grows. So there is a public procurement bill. I'm not very sure how you have been involved, whether you've been involved with that bill, because it affects all the departments, the public procurement bill, because we are saying it must solve these problems, where national imperatives are taken into consideration, not just the price, which will always favor the established, let alone that in small businesses, when it comes to price, they're always undercut. So I'm just saying that that's the context. Hence, the oral members are busy harping on this one. And we're also requesting you, Minister, Deputy Minister, and the executive, that you get closer to these things, that most of the time we are shooting ourselves on the foot. Honorable Matafa spoke about the deliberate actions by South Korea to grow their local economy and the things that they need to do. So we're thinking that at the executive, we must have that discussion a lot. Having said that, we are also aware that health is a concurrent function, Minister, Please just share with the committee and the people of South Africa as the problems that perhaps that create, and then say how would you propose we deal with those things? Because for instance, when you talk about underspending on some conditional grants, we understand that that's what it is, that the provinces, that's in the purview of the provinces. But we're saying, broadly speaking, just share with us what challenges that creates and what are you proposing again in your min-max and so on to deal with some of these challenges. Because as you would know, that when things don't go right, people just know one minister of health, and that's Joe Pash. And we can't go out, us for instance, and say, no, that's in the province and so on. So as members of parliament, we'll always come back to you and say, why is A, B, and C not happening? The next question, I think there was about 768 million rand underspent on vaccines. I think when you terminated the COVID vaccination, but the question is, why didn't you apply for environments or to other programs when it comes to that, so that we have money still being spent in the sector? The underspending, I think I'll repeat this one. Our oral members have already touched on it. It's a big concern, especially when it comes to infrastructure. Again, you would have heard the president saying that infrastructure is so critical for us to grow the economy, so that the other things I spoke about can be achieved. So the question from us is that what is the national department doing about it? Again, very much alive of the fact that this is coming from the provinces, but again, we can't raise our hands and say we can't do anything. What is happening about this, right? Because so much money being underspent, the implications to service delivery, again, about the impact on the economy, on the jobs, and so on the small businesses, 1.8 billion rand. For a department which has got a budget of 60.1 billion rand, we must know that a 1%, a 10% underspending, it's huge in terms of rands and cents. So that's why it should be a concern. Yeah, I think so much has been said about local procurement. I'll leave that to the colleagues have spoken about that. The next question, I just want to check on transversal contracts concerning the Department of Health. What is your involvement in the adjudication of those tenders? It's more on the next one. You shared the percentage with us of what you procure locally as far as the pharmaceuticals are concerned. So I'm just checking. Is the company, are those things being manufactured in South Africa, or is the company based in South Africa? What exactly? I was saying that big pie graph that you shared with us, and you said on this percentage is procured locally. So I'm just saying that is local procurement equal to local manufacturing? And that's for obvious reasons. I just want to check again your participation on the Presidential Employment Initiative. Does the department participate? And if it does, how is it participating? And do you see using that Presidential Employment Initiative to try and deal with the challenge of those employees which were employed for COVID? The question of the buildings that you are occupying and other buildings that you are using, I just want to check who owns those buildings. Is it the department or the government, or are you renting them? That's for obvious reasons. We've heard from other departments that mostly they are renting those buildings. And the question you are asking is that why would you continue renting things? Government is permanent, so it would make sense for us that government owns its buildings. But just share with us what is happening in that area. And lastly, Minister, talking to lay people like ourselves, what would you say? Are we winning the fight against HIV and AIDS? Thank you very much. We'll go back to you, Minister. You'll decide who answers what and so on. And you'll only, I think the colleagues also said that some of the questions that we asked may need further information. You are allowed to say, no, on this one, we'll come back to the committee. And coming back, it means writing back to the committee. Back to you, Honorable Minister. Thank you very much.
Thank you very much, Chair. Thank you. And thanks to all the honorable members for the questions and also comments which have been made. Can I just, DG, you will help me in this regard. I'm going to ask that on the NHI readiness, if we could, the Deputy Minister, if on that matter, if on the high level, if we could start with your input, and then obviously Dr. Crisp will also come in on some of the details. I think there are a number of honorable members who raised questions on the NHI, including readiness on infrastructure, human resources. I think on that one, maybe just so that we take it out of the team, just to say that in terms of engagement of colleagues in the National Treasury, we do both at the cabinet level, but also we have had a number of bilateral meetings. We have had a number of bilateral meetings which included also the minister and his team looking at various aspects of the support to strengthen the health delivery platform, which will contribute positively to our preparedness for the NHI. There are some details which we still have to engage further. Just to give an example, and I'm jump into this while colleagues are going to come in to say more. One of the issues which we're not very pleased with is that there's been an overall sort of understanding that as part of building towards NHI, even before the bill is passed by both houses of parliament, in terms of strengthening the financial capacity to prepare and strengthen the public health delivery platform, one of the sources of possible increase in funding would be the tax credits which are allocated to the medical aid industry, which basically, if those tax credits could be redirected into the public health platform, they would make a huge input. And a proposal has been progressively to start redirecting the income from, in terms of giving those tax credits to the medical aids industry, but to redirect those funds to the public health system. It could contribute enormously in terms of infrastructure, equipment, and human resources. But to our disappointment, Treasury actually increased the tax credit allocation. instead of reducing and reallocating those resources. So I'm just giving an indication that while we're communicating, there are difficulties, but I'll ask just on that one. I'm just trying to go through the category of questions. There are quite a number of colleagues who have and members who have raised those issues on the NHI. So I'll ask Deputy Minister, also followed by Dr. Crisp, also just to say something in the preparation of readiness to implement the NHI. Local manufacturing, I think on that one, support for local manufacturing, if we could get the CFO, but I think also here, if because a number of this would be also on pharmaceuticals and vaccines, if Dr. Crisp could also say a word on this. But of course, we do agree that the Department of Trade, Industry and Competition and Treasury, and we have been engaging with them. They should assist in this regard. But colleagues can comment, can say something more on that. On the funding for NHI, I'm sure Deputy Minister and Dr. Crisp could say something on that. CFO and DG on the Gauteng, specifically underspending. What efforts are we making to support Gauteng and other provinces? I think other members, honorable members, raised overall about what are we doing to support provinces which are underspending. On whether there is also in the procurement to elaborate CFO on the benefits for youth empowerment. You could, I think it's somewhere on your presentation, but if you can say a little bit more. Honorable Sheikh Imam said a mouthful about health promotion and prevention of disease and non-communicable diseases. Also on that one, I think firstly on the wellness of employees and both at headquarters and also in terms of your colleagues in provinces, DG, whether this is a matter you are attending to, if you can deal with that. Training colleges, I don't see Dr. Makanya, so DG, you'll indicate who's going to deal with sort of further input on the nursing colleges. Again, on this one of overall, a lot of what the Honorable Sheikh Imam has said about NCDs, I'll also ask the Deputy Minister to just say some words on that, on the NCDs and what can we do better in terms of dealing with prevention, including on food and all other lifestyle issues. The Johnson & Johnson, I know Honorable Sheikh Imam has raised it in other platforms. If from the affordable medicine on their behalf, I don't know if Dr. Crisp is able to get some information. I'm not familiar with that. And DG on honorable member also says that there are still some doctors who finish community service who are unemployed, over 100. Maybe I could hear from you. I know we met with Samatu and there was a process. I'm asking you because Dr. Mahlati is not is on sick leave. So if you could come back on that. And also on the board exams, you can guide the DG from your team. Anybody who could shed some light in terms of problems with the Health Professions Council in terms of foreign qualified graduates and some allegations of corruption in the board exam area. Vaccines, and believe or reports that they actually have been hiding side effects. And what do we do with the stock which is still in our control? Dr. Crisp can come back on that. Yeah, I didn't hear the question on condoms, Honorable Chair. You forgive me on that. I didn't hear what the question was. On the issue of the state-owned pharmaceutical, maybe let me just deal with that upfront to say that this area in the executive is again a matter which is allocated to DSI, Department of Science and Innovation. Again, it was a wise decision to avoid conflict of interest in health. So the DSI is the one which is driving that. Personally, at this stage, I'm not aware. There hasn't been much update in terms of where the matter is. The security of our health staff is a major issue of concern in facility and also EMS. Especially EMS is on the emergency services, ambulances, mainly in the urban areas. We have difficulties there in terms of, but there's also violence even in sometime in the fixed facilities. And it's a matter which we've been grappling with in terms of the best way to deal with the issue of security. It's one of the areas where there's been also a pressure to say we need to, rather than rely on private security companies, we need to insource. There's been discussions. It's a matter which I was just discussing with one of the MECs that we actually need to bring it back to our MINMEC National Health Council to try and get into some common approach as to how we deal with, because there are positives in terms of insourcing, but there are also negatives. Part of it being, just to give an example, if you insource, it means your security staff, it's permanently for that institution. Now we know amongst others that you need to keep upgrading training. And as a health department, we're really not the primary department in terms of security and training and all that. That's one aspect, but also from a security operations overall, there's an uncontested benefit of where you have a possibility of moving people around, avoiding too much familiarity. When effectiveness of security personnel is also linked to avoiding too much familiarity, where people in security get too much, used to the environment and the people, and they get lax, and they become part and parcel of some of the problem. So, but when you then employ full-time staff, those are some of the. So I've said that we need to, in previous terms, I think in the fifth administration, there was also some discussion, but I think it's a matter which we need to bring back to try and get to some conclusion as to the best way. There's also cost implications. One of the criticisms about the private security is that we pay a lot of money, but little of it actually goes to the personnel. A lot of it is taken as profit by the owners, and the security personnel themselves are paid peanuts, and therefore they easily get corrupted because they have so little income with no protection, no benefits of pension, medical scheme, whatever, and all those issues. So it's a matter which we're going to have to bring back. On accruals, CFO will deal with that. Issues on migration, the impact of that on the health services. I know there's a difficult issue of a court matter. So I think myself and DG will comment on this one of migration. The cost of employment and its impact on our abilities, I think DG and CFO can deal with that. Infrastructure, I don't see anybody from the infrastructure chief directorate, DG, in terms of why there's a slow kickoff. So that would fall on your lap. Nursing colleges again, yes. Yeah, and unless if Dr. Makanya is here, otherwise DG, you'll have to help us there. Malaria, I think Reverend Marawan is on the platform. He can say something about that. On the mental health, especially in rural areas, Jeanette DDG Hunter, and again also services in rural communities, including for cancer and others. I think Ms. Hunter and DG could deal with that. Working with health, with Department of Higher Education and Training for Human Resources. Again, because Mathati is not there, I think DG will deal with that. The development of vaccines. Again, just to say so that we don't come back to it, ourselves as a health department, we are the customer and the consumer. But we work very closely with the Department of Science and Innovation in supporting, the transfer of knowledge in as far as vaccine manufacturing. So we work together at this stage with the support, for instance, of the WHO on the mRNA technology, which they have supported South Africa as a hub for production of mRNA vaccines, which also from the scientists who are informed over and above, although it shot to prominence through COVID vaccines, but we are informed by the scientists that that technology can actually, once we master that technology, can also help to manufacture other vaccines and also other pharmaceuticals and medicines. Vaccines not only against viruses and bacteria, but also against cancer, because of course some of the cancers are also initiated by viruses, and other germs. So that technology, the main sort of department which is custodian of that is Science and Innovation, but we work very closely. So they are the ones who budget and fund those programs, but we work very closely because, of course, it's important that whatever is produced, we have to also assure the fact that it's relevant and it's going to be useful for major disease burdens in our country. Honorable Imam Sheikh, again on the issue of medical legal. Indeed, it's a medical legal, it's a major issue as training on our resources. So we're working with provinces in terms of various intervention strategies to mitigate against the impact of medical legal, including case management, just making sure that all those cases are properly monitored, fraudulent claims are identified and acted upon. So there's both on the legal and forensics and health experts. So we're also looking at creating, we're in the process of creating an entity within the National Department where we bring in experts who can help us to support the provinces in making sure that we can deal with this. But also, because it's beyond, as Honorable Imam Sheikh was indicating, it goes beyond the public sector. It affects private practitioners as well, as is indicated, especially obstetricians, pediatricians, and also neurosurgeons. And there are certain categories where are much more vulnerable to these litigations. And some of those who are losing, as Honorable Sheikh Imam was saying. So we're also working with the Department of Justice to change the law especially on state liability. That will be more on state liability. But I think also once those amendments can be done, it will also possibly help also with the private practitioners. But it is indeed, as the Honorable Member said, a major issue. The EMS DG, I'm not sure whether there is anybody from that. You can help us with that. Yeah, there are areas which I'll come back to once the team have also made their intervention. Intervention on underspending on infrastructure, DG and your team, you could look at that, and the transversal contracts, that's from the chair. And then on local procurement, residential employment, and also on the Dr. A.B. Kuma building, which is our headquarters. What is its status? Are we owning or renting? I'm sure the DG. So DG, I've tried to help, but maybe let's start. Then I'll give over to you as guided, and then I'll come back later. Maybe Deputy Minister, just the areas which I thought you could start on the NHI and then also on the NCDs, and then DG can help us to coordinate along the lines of what I proposed.
Okay, thank you very much, Honorable Minister, and thanks to the leadership that has asked us to come in and make this presentation. Quickly on the one that the Minister has asked me to come on it. In the wisdom of the department, in 2013, envisaging that one day we will have this NHI, universal health coverage, there was a creation of an institution independent of us called Office of the Health Standard Compliance. What it does in the country is to visit health facilities, both private and public, and actually wanting to establish our readiness to really become an ideal clinic, an ideal hospital. So they do leave a facility with a compliance certificate that you do meet a criteria that we have developed to say this is what it would look like if you were to be an ideal clinic hospital, or leave us with what they call a compliance notice to say, look, you're not meeting what you have set up to be an ideal clinical hospital. So fix this and that, get the gate to have a guard in there, let there be a clean fence around the clinic, let there be all these things that we have put there as non-negotiables to really get us to be on an infrastructure trajectory. So that is ongoing, and that work is really preparing us. That's why up to 2 weeks ago, we had a second presidential health compact. It was in 2018 again. South Africans made reports to the president, say, look, we are not very happy with the state of health in the country. And we met over 2 days in 2018 to look into what are actually the issues that are worrying us. And out of that meeting, we came up with nine pillars, which we really would want to say, if we do these issues, infrastructure, human resource, IT in the department, medication on time. So all those 9 pillars there has been our focus and the plan. And just 2 weeks ago, we met again to look into how far are we, because we just do realize that the Presidential Health Compact is a very good precursor or an enabler for us to go into the NHI. So that is work in progress. Hence, our critics are saying we are handing over this NHI to the private sector that has already got good facilities. Yes, they do have good facilities, but there's quite a lot of other facilities, state-of-the-art hospitals, clinics in our country that has been built by government, and we are continuously every day improving on that. And of course, it will not be a one big bang the day we have the readiness for NHI. It will go in a steady fashion, day by day and week after week. So this is a process that we are on it. But just to be on another side, very excited that last Friday was a very historic day for the Portfolio Committee of Health, where the committee wrapped up its deliberations on the NHI. And the chairperson was actually wrapping up the meeting saying they are ready now to bring that to the National Assembly for a debate and hopefully get it endorsed by the sitting of the National Assembly and then go to the NCOP. We're really ready for this. We are really wanting to get this process on. Of course, when you look into the previous president's statement, he was saying we shall implement NHI in an incremental and a staggered manner. So we are not looking into everything being ready in one day in every facility in the country. So there will be even countries that are maturing on universal health coverage.
started the way we are starting. But the most important thing is the commitment to start that all of us now have gone into, and we are doing it very well. The other part, the minister has asked me to comment on the non-communicable disease. Last year, we launched a strategy, which was not the first one, a national strategic plan on the non-communicable disease. But honorable members, this program is actually taking into recognition that a lot of these are behavioral programs. It is about what Imam Sheikh was saying, Honorable Imam Sheikh was saying, is what we eat, whether we do or do not smoke, what we drink, whether we drink alcohol or not, whether we do find time to do exercise. The other fifth factor that is the risk is air pollution. But these first four, we can individually be able to control and also avoid. And the air pollution is when the country is actually supporting its citizens to really minimize air pollution. Because these, if are controlled or reduced, then they impact. So it is not about so much what we do as health, but it is about what we do as a country, as individuals, towards impacting that. So there's an increasing awareness on these processes in terms of this mushrooming cancer, cardiovascular disease, diabetes, chronic lung disease, including mental health. Just 2 weeks ago, we had a mental health conference, again, because we now notice that this is one of our key challenges. So there is a work in progress in terms of non-communicable disease campaign, but we could do more, and with all the support of all citizens in the country, to maximize the campaign and reduce these impacts and have a long and healthy life. Minister, this one was just, I think, a slip on your tongue during the presentation. I may just as well raise it now. You were raising an issue regarding the health market inquiry report, that we are not exercising enough adequate regulatory oversight over private health sector. The minister just slipped the tongue and said the public. The report was actually saying we are not doing enough on the private health sector to regulate. Just that, I just thought maybe for Hansard correction, we should just assist the minister to say that one was meaning private. Thank you very much, Minister. Back to you now.
Thank you very much, Dinamo. Can you have DG just to, I did provide some guideline in terms of, I'm sure you took some notes. I proposed some of the areas which you could coordinate with the team. Can you help us with that? Some of the areas, I wasn't sure who else is here, that I said possibly you might have to deal with them yourself. Can you just drive that and then we'll come back.
Thank you very much. Thank you very much, Honorable Minister. And a good morning to the chairperson, my deputy minister and colleagues. Yes, no, thank you very much, Minister. I have a number of areas that I'm going to deal with, and then support what Minister has said to the colleagues. The first one, the Minister has dealt with the issue of local procurement. I must just add that there is a committee of 4 DGs that has been put together to deal with this matter, which includes myself, DG DSI, DG Treasury, and DG DTIC. And we are due to report back to the ministers at the end of this month on how we're dealing with this matter. But the main issue here, honorable members, is that as accounting officers, we will need to be empowered by the legislatures in terms of policy direction. And I'm happy that the chairperson has spoken about the public procurement bill, because currently when the Auditor General or the SIU comes, it becomes the problem of the SIU if there's no enabling policy and legislation. I wanted just to touch on that one. I think the second one, there was a question on our working together with Department of Higher Education and Training. We work quite very well on a number of areas, but I think critically we have a committee that we call Joint Health Sciences and Health Committee, JSEC, which is a joint committee between ourselves, the Department of Higher Education. We also bring in the deans through the structure called SACOMT, the deans of health sciences and medical education. And here, this committee is co-chaired by our DDG from health and a DDG from higher education, where we look the service needs, the training, the kind of production that we need to be dealing with so that we're able to deal with the matters. But in addition to that, higher education has got a program called Higher Health, which is headed by Professor Ramnik, where we work with them actually mainly to ensure that we have health services within institutions of higher learning, including prevention programs. We also use the similar one for vaccination and a number of areas. So we do work quite well on that level with that department. Then there was a specific question on the presidential. There was a specific question on the presidential employment stimulus package. Yes, this was introduced in 2020, and as a Department of Health, our participation was through the recruitment of nurses. The big snag that we hit was that in terms of that program, they were only offering 3 months contracts, and that gave us a problem with the unions, as they demanded that we give people permanent employment. We were able to recruit about 200 nurses, but you can imagine that if the contract was for 3 months, it became a problem. Then we're not able to proceed on working with them on that one. Then, Minister, the question on condom manufacturing that was raised by Honorable Imam. I was fortunate that in my previous job as a CEO of SANAC, I was part of the team that was looking into this in terms of local condom manufacturing. The big problem here, honorable members, is that for condoms, you need latex. And latex, mainly the 4 main countries that actually manufacture latex is Malaysia, Vietnam, Thailand, and Indonesia. So even if you're manufacturing in South Africa, you still need to import, and there were huge import costs. There is one current company that is manufacturing condoms, but I know they are quite struggling. And the similar issue when it comes to procurement, as it happens with drugs. I know Professor Cliff will touch at this on that. It becomes also one major national problem. Then there was a question of the J&J. This is there's a number of cases in the US based on the J&J powder, which is claimed to contain talcum, and that talcum was actually linked to ovarian cancer and mesothelioma, and they've taken the company to court. But when it comes to South Africa, the problem is that this powder is actually not regulated under the Medicines Act. Hence, as a department, as a custodian of that act, we are able to do anything when it comes into dealing with that issue. Then the next question was on transversal tenders. For all transversal tenders that involve health, the accounting officer is always expected to nominate officials to participate at all levels of that tender. So we are involved, Honorable Chair, in terms of from specification level, especially as a end user department, evaluation, and also the award of that contract. And then the Deputy Minister has covered the issue of NCDs, but I would like to add that as the member wanted to know that whether we have budget for that, the answer is yes. Actually, in our APP, we've got 4 specific indicators that deal with non-communicable diseases. And one of those indicators is specific to us working on how we can actually restrict the advertising of unhealthy foods that are mainly targeted at children. Then the next question I want to deal with is on the nursing colleges. Currently, honorable members, we for the 23-24, we have 39 nursing colleges that are at different levels of refurbishment. And we've recently finished 4 nursing colleges in the last 3 years that were being refurbished. That was Middleburg, Tohoyando, Paraguanath, Chris Hani Paraguanath Hospital, and Butterworth. We were due to do Henrietta, which is in Kimberley, but the province wanted to actually relocate that college to another area. So we are still waiting for the province so that we can proceed with the work in that particular area. And then on the issue of Gauteng, of course, there is support to the provinces. What we actually do, we have the CFO's forum whose main aim is to just look at how the provinces are assisted in areas. And we do have a dedicated unit led by Chief Director, Scott Provincial Support Unit, that works with provinces to assist them on areas where they have issues in terms of underspending and the other areas. And for this financial year, specifically as it comes to the conditional grant, we have actually implemented an intervention where we are actually we've asked the provinces as they are a transferring accounting officer that we are not going to transfer money if we don't have procurement plans, because we've picked up that they start getting worried in the third and the fourth quarter of the year, which is sometimes very late even for the budget adjustment. Then they want to procure equipment. So we've put this in place now that we want to be trying to procure equipment in the first and the second quarter. And the CFO is actually very strict on this one. And of course, myself as an accounting officer. Specifically on Gauteng, yes, there was a delay on a number of equipment. The one that is quite close to the minister's heart is the cath lab at Steve Biko, but also the linear accelerator in a number of hospitals, including Charlotte Maxeke, which now we've been assured by the province that they are at the final stages of award, and it's with their provincial treasury. They have a bit of a complicated procurement system in that province. So, but we are constantly working with them. As late as last week, the CFO and I actually met with the CFO of Gauteng and also the HOD of Gauteng. The next one that I want to deal with, Honorable Minister, is the one on the EAP programs. Yes, all the provinces actually have got a dedicated what we call EAP, which is Employee Assistance Programs. And in most instances, they work either internally and also use external service providers, as we have also done at national during the time of COVID, where we worked with ORAM to try and assist us in some of the work. We are at the final stages at national of actually establishing our wellness clinic for staffs, and most of the provinces have done the same to assist. But critically on the issue of mental support, I know specifically, for example, in KwaZulu-Natal, they work very closely with the University of KwaZulu-Natal in Pietermaritzburg on the provision of support, mental support services for our healthcare workers who really had to bear the brunt of this epidemic that we had to deal with. Then the issue of the board exams at HPCSA, we do hear some anecdotal information around these issues, and we've also been actually taken to court. The HPCSA, some of the students who failed the exams, especially those who've studied outside. I know there is a current one that is active that we are dealing with, but we've not really had a formal, and those are not really around. They are not really around the fraudulent exams. But it's mainly people who feel that they've not been offered opportunity to write, or they write, like this one who's taken us to court has failed about 4 times the board exams. But maybe Professor Crispy will comment on that one. Then the issue of in-migration, which would be the last one that I'm going to deal with, as the Minister has mentioned, it's a very difficult one. And the health sector, specifically those provinces that are at the borders, are really suffering. And also Gauteng, and a number of hospitals in Gauteng. If you look at hospitals like Helen Joseph, hospitals like Rahima Musa, the information that we have is that about 60% of deliveries in those hospitals are people who are actually illegally in the country. So we did have a meeting yesterday, specifically because we have a current court order that we cannot exclude foreigners, those who are under 5 and those maternity cases. So we're actually putting together a team now to actually come up with a business case, because this is really putting a lot of pressure on a number of hospitals in Gauteng, in Musina, other Limpopo, but also in Mpumalanga and other areas. And I was told that there are hospitals in Mpumalanga that are at the border of Mozambique. that are seeing almost 80% of deliveries that come from across. So it's a bigger problem than us. We need to be working hand in glove. Of course, Treasury will need to compensate us, to assist us. How do we put in compensatory mechanisms to deal with these issues? It's a bigger government issue also with Home Affairs. On that level, I would like to request Professor Crisp to deal with those. We've been talking on the side on those mainly NHI as the minister had put in. Then I will ask DDG for primary healthcare, Gillette Handa, to deal with issues around mental health that have been raised. We've already dealt with NCDs. And then Reverend More, Jeanette as well, if she can deal with the issues around malaria, but she can be assisted by Reverend Morewane on that one. And then the CFO will then end on all the finance-related questions. Thank you very much, Honorable Chair. I will hand over to Professor Crisp.
Thanks very much, DG. Good morning, Chair. Good morning, Honourable Minister, Deputy Minister, Members of Parliament and colleagues. So I'll just briefly respond to those numbers of issues that the Honourable Minister and DG asked me to, but some of the comments have already been made by the Deputy Minister. So as far as national health insurance is concerned, as was mentioned already, the bill is ready to go to the National Assembly for voting on. And we have been preparing for years on a number of terrains, but specifically getting ready for the implementation of the bill. What we have done in the National Department is consolidated a branch. We are busy with the employment of people to do some of the preparatory work, which will enable us to design what is necessary for the Schedule 3A entity once the bill passes into law. The foundational work that is being done in the preparation for the financing is largely concentrated on the digital capacity, which means that we need to understand how we're going to manage the benefits, how we're going to manage the payments, the different kinds of capitation payments and diagnostic-related group payments that are specified in the bill, and also to make sure that we put in the necessary risk identification and fraud management processes right from the word go. We will also be looking after the product procurement space in the NHI, and I'll talk briefly in a moment about procurement and the advantages of procurement, but let me just finish with the NHI. So in preparing, what we see happening over the coming years once the bill is enacted is that funds that are currently spent in the health space, which is about 8.5% of GDP at the moment, will move depending on where they are and how the law currently guides them. So in the public space, it's about 265 billion rand, which is largely in the provincial departments, provincial equitable shares, but also in the 60 billion plus that are in the conditional grants managed through national, plus the Department of Correctional Services, and there are smaller amounts that are in other parts of the public service. Those funds need to systematically be moved, depending on their legislation, into the fund once the fund is prepared to be able to spend the money. Of course, there's also about 277 billion rand spent in the private sector, which is spent on only about 15 to 20% of the population. And we need to find alternative ways of moving that money. And provisions in the bill are for different forms of taxation, which we will get to with Treasury and the Minister of Finance when the time arrives. But as the Honourable Minister said, we are disappointed that the 35 billion rand tax credits have been increased rather than being moved to enable us to be doing some innovative work on strategic purchasing in the primary healthcare environment in particular. And that's a matter that we will be engaging on as we go forward, building the capabilities. So at the service delivery level, what the bill does is it separates the purchaser and the provider. And as you've heard over the years, there has been funding allocated for a range of projects to test various ways of strengthening and improving the service delivery capacity, including ideal clinics, ideal hospitals, different ways of GP contracting into the public service, and so forth, most of which have been reported on in this forum in the past. Some of those projects are now, we are able to strengthen them and move them into the new service delivery format. but some of them will have taught us lessons on how not to do things. And so we will avoid those that were not that constructive and strengthen the ones that have been constructive. Obviously, there is a need to strengthen infrastructure in the public sector, but I don't think everybody understands that once we are able to refer patients that at the moment are entirely dependent on the public sector into private facilities and purchase the services through the fund, the pressure will be relieved on some of the public facilities which are overburdened at the moment. That will give us a bit of breathing space in those facilities and allow for additional time to do more maintenance and also to take the heat off some of the staff in those environments. At the moment, we spend about 5,200 Rand per capita in the public sector on healthcare and 28,700 Rand per capita in the private sector per annum. This is clearly not sustainable, and so that is what we are aiming to amend. Yes, there are people who are looking for good reasons not to implement the NHI, but from the health department, obviously, we see this differently. We see health as not being a tradable commodity, but as being a public good, and a public good is something that needs to be dealt with due care and responsibility by government. So that is why we are anxious that we should move into the next phases of implementation of the National Health Insurance. Are we confident? As the Deputy Minister said, this is not a process where you switch on an NHI and next year suddenly everything is sorted out. Countries that we have worked with have told us it takes anything between 15 and 30 years to fully roll out this size of reform, and we don't expect it to be any different in South Africa, and we will find our way as we go. As other countries have told us, you cannot define every corner of your health service for 30 years into the future, but you can certainly have a confidence of the framework that you're putting in place from the start, and we think the NHI bill does that very adequately. I'll move to vaccines. So the Honorable Sheikh Imam asked various questions about vaccines. We are well aware, and we are on a daily basis petitioned by various people who have negative views about vaccines. But we know that vaccines have been available for many, many years, and they are the single most efficient way to deal with communicable diseases. The interventions that we've had with measles, tuberculosis, getting rid of almost completely in the world, getting rid of polio, smallpox, and so on, have all been thanks to vaccines. All vaccines and all medicines have side effects. That is no news to us, and it's no news to anyone in the world. We know about side effects. In fact, some foodstuffs have side effects for some people. So that is not something that we are concerned about. What we do is we monitor those side effects. And we have a very robust reporting mechanism in South Africa called adverse events following immunization, with a research done into every single case that is reported on the adverse events reporting templates to SAHPRA, who's the regulator responsible for pharmacovigilance. When those cases are notified, especially if they are serious adverse events, and there's a global classification of what that is, we investigate them very thoroughly, and we report on them. They're all in the public domain on the SAHPRA website, and we are monitoring every new case that is where the investigation is concluded. So we are aware of where there are mild side effects, frequently perceived short-term side effects, and occasionally very serious side effects, which, as I say, you even get with peanuts and other foodstuffs. So we follow the science, we follow the evidence, and we follow what is happening around the world. We are part of a very big reporting and global community. We are not concerned that there is anything dramatically different with these vaccines that we are using now from other vaccines. And although the mRNA vaccine was used for the first time during COVID as in a massive mass programs around the world, it has been around for many years, and there have been lots of experimental vaccines leading up to the mRNA that have been tested in other environments for other diseases. And as the Honourable Minister said, We are very happy that the mRNA platform that is being developed together with the Department of Science and Innovation and at the Afrigen hub in Cape Town is going to put us in a good position that when there are other new antigens or diseases that we have to deal with, we will be in a good position to respond. What's important is that we want to have the intellectual property, and we need to be able to work with the rest of our colleagues in Africa to maintain that intellectual property and not have to go and buy these out elsewhere in the world. We will, unfortunately, not use all the vaccines that we procured 2.5 or 3 years ago. They are in storage, and we'll use as many of them as we can until they expire. But when they have to be destroyed, there's a very clear and robust process that we go about for destruction of any biological product, and we will have to destroy them at that point. And I'm sure you'll be informed because we will be very transparent about that in the public space. So the development and the manufacture of vaccines and any other pharmaceuticals, as you've already heard explained, is something that we are interested in. We are the purchaser of these products. We work closely with everyone, including the public sector side of the potential for manufacturing in South Africa. But we also work with the private sector who are manufacturing. Now, there was a question asked us, are the local pharmaceutical products actually made in South Africa? And the answer is, in terms of what we call API, active pharmaceutical ingredients, which are the basic substance that is what treats us, those are not made in South Africa. We import nearly all our active pharmaceutical ingredients, both for pharmacological products and for biological products like vaccines. And we import them at a price because of the intellectual property. So whether they come to a private sector manufacturer or a public sector manufacturer, we will still have to import and pay for that IP. So it is far more complicated than meets the eye. But what we do at the moment in our transversal contracts that we manage from the National Department for about 1,200 of our main products is we actually pay more for local products. So where the API is imported, processed, like bottling, what we call finishing and filling, packaging, labeling to our standards in South Africa, we actually are prepared to pay a premium of up to 15%, and that goes into our tender documents. It's not cheaper to manufacture inside South Africa unless we are able to manufacture APIs, which at the moment we are not able to do. So we've got a long road ahead of us before we get out of the situation we're in right now. But we do have several large pharmaceutical manufacturers in the private space in South Africa who work with international companies around the world, and we do purchase from them. And where they are involved in local packaging and so on, they do get preferential treatment so that we do create jobs in South Africa. I think those were the main questions that I was asked to answer, so I'll leave it at there. Thank you very much, DG, Minister and Chair.
Thank you very much, Prof. Jeanette, do you want to come in?
Thank you, DG. Honorable Chairperson, honorable members, the Honorable Minister and Honorable Deputy Minister DG, I will just greet you and my colleagues and ask for permission to switch off my camera because I may have poor network. Honorable Chair, the first one on malaria. Firstly, we do have a budget for controlling malaria in South Africa and to some extent our neighboring countries, and I'll speak a bit about that as well. But of course, the budget is never enough. Like any other program, who would have an opportunity to speak here will say to you. So we have a number of districts within 3 provinces in this country where malaria is endemic, and those are districts in KwaZulu-Natal, Mpumalanga, and Limpopo. And we are doing very well with the malaria program, Honorable Chair, and I'll tell you why I say so. South Africa as a country, as part of the Sustainable Development Goals, set itself a target to by 2030 have 0 malaria cases in the country. And so currently we are working systematically towards it. We have set intermediate targets towards that 0 number. And the intermediate targets speak to 0 incidents of malaria in some of our endemic districts. And we've actually done well in the 2022-2023 financial year, which we have just concluded. Now, where the issue comes up, I think members may have seen a recent report in the media as something that was put out by the NICD, is when we have malaria, even 1 case or 2 cases or 3 cases within our provinces that are not endemic. And we often find this in a province like Gauteng and the Northwest, where you have what we call suitcase malaria cases, which means those cases have been brought into these non-endemic provinces through travel. Yeah, and that raises alarms because we need to attend to it, because we are serious about eradicating malaria in this country. And so every case needs to be taken seriously. So we do have a program that we run with the 3 endemic provinces and the non-endemic provinces. In the endemic provinces, we focus mainly on spraying so that we can start with the source of malaria before people even become ill. We also directly support Mozambique, because if we can assist Mozambique to also lower their incidence to work towards eradication, South Africa will be successful. And then there's a collaboration with both the 2 countries that are landlocked in South Africa, and plus our neighboring countries to work together.
DG, we seem,
on a
we seem to be losing Jeanette.
In Africa. The endemic provinces we do. Let me see if I move around, Minister. Am I coming through now?
I think just summarize quickly. We don't have time as well.
Minister?
I'm saying summarize quickly,
Okay.
because
So
we also don't have time. Yeah. No, it's not working.
Okay, so one is we are actually doing well. We are actually doing well as a country. And so then I'll move on to mental health. But before I get to mental health, let me actually just say something briefly, Minister, about access in general to rural areas. DG, am I coming through now?
Yeah, you are better. We can hear you.
Okay, yeah. So this government has actually done much in terms of setting up, especially primary healthcare in the rural corners of South Africa. And so we are well in terms of infrastructure, and because Minister has asked me to summarize, I won't go into it unless there's questions about why I say so. So in terms of taking all programs and especially mental health into the rural areas, we are not taking it, it's already there, but further strengthening it. We are well poised to do that. So with mental health specifically, we have started about 2 years ago already to roll it out into the primary healthcare facilities through investing in specialist skills to deploy into the primary healthcare facilities, but also to train generalist skills to be able to attend to mental health in terms of prevention and treatment as close to where people live. Let me stop there, Chairperson.
Thank you, Sefo.
I will cover the remaining questions on the request that the Honorable Chair and members they've done with regards to supplying the information on the 5-year underspending on our direct and indirect grants. We'll supply such information. And there was a question on 768 million, why we could not apply to shift the money. So that money on the vaccines is an earmarked funding, so the department could not move the money without the approval from National Treasury. We did request to move the money to fund some of the invoices from our Central Chronic Medicine District, which is the program where we take the medicine to the people, as the minister has already explained earlier. So that's the reason why we could not move some of the money that is sitting under that underspending of 768 million. And then there was another question relating to the accruals. I think that one. So with regards to the accruals as a sector, moving from 2017-2018, we're sitting on 14.1 billion. We managed to decrease the accruals in 2019-2020 to about 12.8 billion. However, during the COVID, we have seen an increase in our accruals, which it went to 15.3 billion in 2021. And in 2021-2022, it has increased by almost $1 billion to 16 billion. So as we have indicated, so most of the provinces which there has much pressure on the accruals was Gauteng, which was sitting on 6.3 billion, which was followed by Eastern Cape, was sitting on 4.6 billion. And we also had KwaZulu-Natal on 1.4 billion. And we also had the Northwest sitting on 1.3 billion. And all other provinces were below the billion accruals, including the National Department, which was sitting on 750 million in the previous financial year. With regards to the current year, together with the provinces, we are busy finalizing the compilation of the accruals, which we'll be able to share with the committee. And then we'll also do the analysis and provide to the committee on the request to supply the information on the service providers. Those are under the age of 13, as we don't have that information currently. And of course, as I've already indicated on the issue of accruals, immediately when we have the pressure on the accruals, an indication already that some of our invoices we're not paying within 30 days. However, during the financial year, we do make sure that all suppliers are paid within the required time frame. Yeah, I think I've covered those DG. Some of them they've already covered, even the ones on the local productions. That's just to also support what Dr. Prof. Crisp has already said. So on the one that I've already indicated on the slide, all those ones, they were manufactured in South Africa. However, we'll have those that the medicine has been imported to the country, and those service providers, they're doing the packaging and the distribution within the country. Thanks, DG.
On the building, CFO, who owns the building?
I can probably come in. I can come in on that one, Minister.
Okay.
Yes, the current building that we are in, of course, maybe let me just put a preamble that the Department of Public Works is a custodian of all the accommodation for the departments. And the current building was acquired by Public Works from Exaro. And as a department, then they then subletting the building to us as the National Department of Health. Thanks, Minister. But maybe there's a time to hand over to the Minister. On the ambulances, Minister, we've got a very comprehensive response that we've recently done that covers all provinces, the response times, the number of ambulances. So I think I will get through to our parliamentary liaison officer to submit, because it answers most issues around the ambulance services. I will hand over to my Minister. Thank you very much.
Chair, we are aware that we have run out of time. Just on that matter, just to mention that the provinces have raised with us that we need to intervene on their behalf in terms of the transversal tender for motor vehicles, which also include ambulances, because there are service providers who are appointed on the basis of that transversal tender to fix when the ambulances are broken. And some of them take very long turnaround time, and there is no flexibility because the service providers are procured in terms of the transversal tender. I'm leaving that also. I think DG and CFO need to just follow that up in terms of detail. We have run out of time, Chair, but just to say on your question about concurrent functions, just to say that it is indeed a complex situation which we need to navigate and work cooperatively. So it's always, I mean, even for instance, on the conditional grants, It's a leverage through which we are able to drive certain programs in terms of your communicable, non-communicable disease, your infrastructure. We're able to intervene. But at the same time, when a province is not performing, the difficulty is once you have made the allocation. I'll give you an example. We had a challenge at Charlotte Matlake when the province of Gauteng was not moving to fix the damage after the fire. And there was an expectation or a hope that because we are the ones who allocate the health facility revitalization grant, we could use their portion to actually, when the Premier had asked that we should intervene because their Department of Infrastructure was moving very slowly, that we could, that National Department should come in. There was a hope that we could use those funds to actually drive the process of rehabilitating that building using our national infrastructure team. But then Treasury we informed by Treasury that once you have allocated to the province, you can't go and actually implement because that's the funds which you have already allocated to that province. So that just to give you an example of where sometimes there is pressure, and then you are informed that the funds are already allocated. If the province is not performing, you can in the middle of the financial year when you have allocated those funds, then come back and be the one who's going to implement that program. So it's a kind of a difficult situation in various areas with so you have to find a way both at an administrative and also at the political level, just to find a way through which there is cooperation and where we necessary, we provide support in terms of making sure that services can be delivered. But for instance, when a hospital is not functioning in terms of delegation of, for instance, we've been just Gauteng again as an example with the four big central hospitals. We've been pushing for delegation of even financial authority to the CEO so that they can make decisions when there's remedial work to be done at the hospital. We had an agreement that there's going to be delegation to the CEOs, but it's not been happening. And we have, in terms of how far you can push to make sure that those improvements can be made, it's a matter of just navigating through some careful nudging in negotiation and trying to help where possible. Let me leave it there, Chair. Thank you very much. We apologize. I didn't expect that we'll go through too much of even beyond 12 o'clock, but that's where we are. Back to you. Thank you.
Thank you so much, Honorable Minister. I think it's time well spent, as you know, that issues of health are so critical to all of us. But before I let you go, two things. Let me recognize Honorable Ncube, who's I'm also told is on the platform from your portfolio committee. But before I let you go, Honorable Jacobs, Dr. Jacobs, the chair of the portfolio committee on health, are you still here? A quick comment before I let the minister and his delegation leave. Dr. Jacobs, are you still on platform? Or in the absence of Dr. Jacobs, I'm sure you might have left us. One member from the Portfolio Committee on Health, a comment from your side?
Thanks, Chair. Chair, this is Comrade Taba, but I think that Honorable Gela is there and Dr. Jacobs, they are still there. Honorable Gela is the Chief Whip. I think he may comment. We have since been following all what has been said. Maybe can I give opportunity to her? Thank you, Chair.
Thank you. Thank you. It is Honorable Klaba. Honorable Klaba, thank you. Honorable Gela, please come in quickly.
Thank you very much, Chairperson, for the opportunity. I think the department has said mouthfully in terms of health issues. And correctly, we are at the end of the NHI bill. Last week we had a list, and then on the 24th, we'll be bringing the bill to the House for approval. Of course, Chair, we are noting all the challenges that we are faced as the health department, but we believe that we'll overcome all the challenges. But also we request more resources to the health department, as you indicated, that health, without health, we are nothing, Chair. So really, we really appreciate the opportunity that we were called, the Minister of Health and the Deputy Minister were called to come and present the challenges that we have, and also the plan in terms of mitigating and make sure that we correct all the challenges that we are facing as a department. Thank you very much, Chairperson.
Thank you so much, Honorable Gela. Again, we are coming to an end of this agenda item, and take this opportunity to thank you, Minister. We know that we've got a lot of issues we must be dealing with. The Honorable Minister Joe Pasha, Deputy Minister Sibongiseni Dlomo, the DG Sandile Telezi, and your team. Thank you very much for honoring the meeting. It's if we were lawyers, we'd be saying that we're having the full bench of the Department of Health. We really appreciate it. We also are aware of the challenges that we are having. And as you know, from your own budgets in your houses, the question of many wants and limited resources, you try and stretch the rand. That's why you hear this the question of value for money coming up and again. I'm really getting value for money because the resources are scarce, as you know. The performance of the economy has not been good for a number of reasons, including the health pandemic, that is COVID, which impacted the economy negatively. So there are all those things that we should deal with. Once more, thank you very much. And this takes us to the end of this agenda item. We are still free to stay on the platform, very open as a committee. But again, understanding the challenges that you are having, we are free to leave the meeting. Thank you very much.
Thank you very much, Siabok. Thanks.
Thank you. Good luck, guys. All members, thank you. Let's go to the next agenda item, which is dealing with the minutes of 9th of May. Yes, the 9th of May. All members, the minutes were circulated, were given to us. Can I get indications of the mover of those minutes?
I so move, Chair.
Honorable Tobias Mose, seconder. Honorable members, do I have a seconder?
Kaiso seconds, Chair.
Honorable Kaiso seconds. Thank you, Honorable Kaiso. So the minutes of the 9th of May 2023 are duly adopted. All members, let's go to the next agenda item, item number 5. Darren, do we have any announcements from your side?
Chairperson, no, nothing. It's just a reminder about tomorrow's meeting with the Department of Public Works and Infrastructure. The meeting will start at 9. We are still waiting on the presentation. I will just do another follow-up immediately after this meeting. Thank you.
Please do that. Thank you. All members, let me take this opportunity to thank you for the engagement and for being in this meeting, engaging with the presentation by Department of Health and the issues, very critical issues that you raised. That's well appreciated. And thank our support staff always, members of the public who joined us on the platform, members of the media. Thank you very much. All members, this brings us to the end of this meeting. Let's meet tomorrow. And good luck with the debates for those who are debating this afternoon. Thank you.
Thank you very much, Chair.
The chair.
Thanks, Chair.